Good morning, and welcome to the September 1st Tuolumne County Board of Supervisors meeting. Supervisor Kirk, will you please lead us in the Pledge of Allegiance?
Ready, begin. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. At our last meeting, Ms. Ryan announced that we were working on a new system that is going live this morning that will hopefully help us so that we don't have the time delay between what the public is seeing and what is actually happening. And so I want to thank staff as we roll this out. And Ms. Ryan, if you would please read the public participation procedures for today's meeting.
In order to protect public health and the safety of our Tuolumne County citizens, this Board of Supervisors meeting will be physically closed to the public. During the board meeting, citizens who wish to comment should be prepared to use our call-in line at 209-533-6581 to queue for public comment. Public comment will be open and closed individually for each agenda item listed below. If you wish to comment on a specific item, please call in when the board clerk has read the item. The chair will ask if there are any comments from the public at that time. Your call will be taken in the orders received. The public comment time limit on each item is set for 3 minutes per speaker. The time limit does not apply to staff. Options for public access, audio and video live streaming. The public will not have access for public comments through these media. These are available for audio and visual only. First option is the Tuolumne County website, www.tuolumnecounty.ca.gov/745/board-meetings, or access Tuolumne County at https://media.accesstuolumne.org/cablecast public site/watch/1 channel=1, or which we are working on today, which is our new audio and video through Zoom webinar via computer at https://zoom.us/j/987-373-85155, or you can call in at 1-669-900-9128 with webinar ID 987-3738-5155. Note, Zoom webinar services tend to have a reduced broadcasting delay in comparison to the county and Access Tuolumne live stream, and is suggested for the closest to real-time viewing and listening. Important public notice. Under the Governor's Executive Order N2520, this meeting will allow members of the Board of Supervisors to participate by teleconference. And under Order N2920, accessibility requirements. If you need swift special assistance during the board meeting, please call 209-533-6581.
All right, thank you. So at this time, I'd ask if there is any oral communication. The public may speak on any item that is not on the printed agenda. No action may be taken by the board. Do we have anyone waiting for oral communication? We do not. All right, I will close that and ask if we have any staff reports this morning.
Yes. Trying to get my fire phones in here. Okay, good morning, board. My name is Liz Peterson. I'm with the County Administrator's Office and the Office of Emergency Services. This morning, I would like to tell your board and the public about the successes from last week's mock fire. What I'm about to share with you only scratches the surface, but I want you to know about your staff, our partner agencies, and the community, who all came together to do their individual and unique parts. I could talk all about our IT staff, who after a call the day the fire started, immediately jumped into action, setting up the EOC with phone, radio, and computer access, or the fact that our tribal partners stopped by the EOC 2 days into the fire, willing to help in any way we needed. Or I could tell you about the American Red Cross and how our local reps worked through the night, the day the fire started, to provide a safe, physically distanced shelter for evacuees once their hotel vouchers were gone. Or the roadside brushing we did with CAL FIRE and county roads using CCI funds on Priest-Coulterville Road, where the fire was held. The Sonora PD and CHP, who patrolled the fairgrounds constantly at night to make sure the evacuated animals were safe. Or your animal control staff, who worked almost 250 hours evacuating and caring for pets and livestock. The Sonora High School Transportation Director, who called to offer their buses for evacuees. Or PG&E, who contacted me to confirm where we were sheltering people so they could cancel their planned power shutoff for the weekend at the fairgrounds. But this morning, I would like to tell you just 2 stories of partnership. At Tuolumne County, we feel strongly that everyone has a role, and it is more than just our firefighters who contribute to the success of a fire. Last year, your board set up the Fire Safety and Community Resilience Task Force, which was comprised of county agencies and partners meeting monthly to develop goals, discuss plans, and implement projects related to fire safety and community resilience. Because of our belief that everyone has something to contribute, this task force included some partners that wouldn't normally be at the table for a fire conversation. One of those partners was Madeline Amlin, the county's GIS analyst. As a mapping extraordinaire, she accepted her role in fire safety, and the day the mock fire started, she put together a public map for individuals to see road closures and their evacuation zones. She also put together a GIS coordinators group out of the Fire Safety Task Force that met monthly with other GIS magicians, as I like to call them, who discussed mapping needs, projects, and ideas to better bring information to the public when fires started. As a result, when we heard the ICP needed additional GIS support for the mock fire because resources were stretched thin statewide, we were able to reach out to this coordinators group, who had already been engaged, and we had 7 different individuals who were ready to assist CAL FIRE. One other story I'll share. We've all heard a lot about the difficulty of evacuating those with access and functional needs, especially during a fire. So last year, we worked with our partners to discuss our plan and ensure we were all in agreement about all our partners were engaged and aware of the plan. So when Sheriff Pooley called for evacuation orders for the entirety of the Groveland area and Pine Mountain Lake, we went immediately to implement our plan. Darren Grossi from Tuolumne County Transit had given me his cell phone number just hours before and told me buses were available for whatever we needed. Lucy Tyndall with Southside Senior Services and Kristen Milhoff with Area 12 Agency on Aging took their lists of seniors who couldn't drive or needed evacuation assistance and directed them to the sheriff immediately, as planned. The sheriff had his staff call each and every person on those lists, and his deputies drove to those homes, evacuated all the folks who needed assistance, and took them to Moccasin, where we had Tuolumne County Transit buses waiting to take them to the fairgrounds, where they were safe, and eventually put in a hotel room for the duration of the fire. There are definitely things we can learn and improve on, but the mock fire is a great example of what happens when every agency is engaged and contributing. Lastly, I'll leave you with these words from the governor about our firefighters. We can't forget about them, including your very own Chief Cashy and Chief Murphy doing their part for the success of the mock fire.
Here, this mock fire. This is in and around Hetchetchee. Could have impacted the entire Hetchetchee system, which is that 167-mile gravity-fed system that actually feeds the water and a lot of the power for the city and county of San Francisco and the region as it relates to the Public Utilities Commission that manages that region through their work. There was real concern around this fire. Just 2,800 acres on Monday. The containment over the weekend, we got to 20%, but real concerned about the impact that this could just go. And I'll tell you, if you want a good news story, if someone actually wants to write a good news story, learn about the heroism of the firefight and the firefighters there. 60% contained in over a 48-hour period, and they kept it at 2,800. It's an old adage in politics broadly defined, unlike baseball, you don't get credit for saves. Let's hope that these firefighters get some credit for what they were able to produce at this fire. We've been talking a lot about it privately, and I just thought it was important to share that publicly. Great work at CAL FIRE, great work of our mutual aid system, demonstrably exampled in the mock fire. The chief.
That's all I got. Thank you.
Supervisor Gray.
Boy, haven't we come a long way since the rim fire. So I was one of those that got a 5-day vacation from my home, and I had some nice digs at my sister's house. But I just want to relay some of the things that I've heard from some of the constituents up there, how well they were treated, what good accommodations that they had, and couldn't believe that they were getting 3 meals a day, and it just went on and on with some of the people. And the updates, I was able to send them to those sites that Liz has spoke about, and they knew what was going on, what was very helpful. Did we get a few complaints? Everybody wants to know almost everything. I think we told them a lot. I think we did a wonderful job. Firemen, thank you. Great job. I drove through that area on Sunday, and still guys out there, still work being done. Some great fire breaks now. I think we'll be okay for the next one. But when you look at where that proximity that was to that HSE system, the governor is completely right. It could have been devastating. It could have been billions of dollars of damage should things have gone awry. So thanks again. Great job, everybody.
Yeah. I was in the EOC when Chief Cashy came in the first day in his Nomex, having pretty much driven from another fire. I'm not sure, but it was up in, I think, somewhere in the north of the Bay Area. Having worked an entire day, and told us that we weren't going to get any more resources. And that was pretty discouraging, knowing what was at stake. For a lot of people that don't realize it, there is a drainage that if that fire had crossed Priest Coulterville Road and gotten in that drainage, it would have gone straight up the hill to both Big Oak Flat and Groveland, and probably taken both of those communities out before we could have gotten it stopped. The nice thing about having the relationship that we do with CAL FIRE is that they have direct connections to the state, and we did get additional resources. I don't know how he did it, but we did get some additional resources, and we were able to stop it. Having said all of that, you can't, I don't care how many resources you have, you can't stop something like that without the people that are on the ground and those firefighters that were out there working incredibly long shifts and everything. We dodged a bullet. We dodged probably about a 107 millimeter howitzer bullet. So thanks to CAL FIRE, thanks to all the firefighters that participated in it, and thanks to the state for releasing some resources they didn't probably really want to. For those that weren't paying attention, there were a very large number of very serious fires throughout the state. I think probably every firefighter in the state was engaged at one time or another. So thanks again to everybody, and all the cooperators that Liz mentioned. You know, we can fight the fire, but if we can't take care of the people that have to get displaced and all that stuff, that's important too. Thanks.
Supervisor?
Yeah, I agree with those comments, and I just want to highlight that with the large number of fires going on across the state, the number of resources, the primary resources that we were able to bring to bear on that fire were Tuolumne County resources, and that's from top to bottom. I mean, it was a great collaborative effort with a lot of state agencies and with other fire resources outside of our county, but your Tuolumne County firefighters were doing the majority of the work on that fire from the very beginning. I had the opportunity to drive the perimeter of the fire line yesterday, and I can tell you it's some of the worst, geographically speaking, it's some of the worst terrain that you could have a fire in. Sheer cliff sides and very steep hills. I don't know how y'all manage to haul hoses and fire equipment up those steep hills, but you do it, and you do it with great heroism and professionalism. I see that Liz has left, but I wanted to highlight something. She mentioned very briefly the CCI funds that were spent on the brushing project that took place on Priest Coulterville Road about 8 months ago. That was done at her initiative. Those funds were acquired 2 years ago and have been spent on roadside brushing projects. And so this, to me, really highlights that fire safety in our community, it doesn't happen overnight. It takes a great deal of planning and it takes coordination. This is something, we were able to hold the fire line at Priest Coulterville, and this is due in large part to some of the prep work that was done on that road months in advance, and with money that we obtained through the state years in advance. So it takes a long time, and it takes a lot of planning. It takes a great deal of thought and coordination, and your county staff are the ones that are doing that. They're doing it every day. They're doing it in the wintertime when fire isn't on everybody's mind. This work is going on. So I really just wanted to highlight that, and really thank you guys. Thank CAL FIRE and thank our county staff for it does not usually work this well. So really appreciate the way that this fire was handled. So thank you.
Sure, I'll make it somewhat short and sweet since everybody said so many wonderful things. But when I got word of the location, I went on Google Maps, and I looked at there, and I think I said it in the text message to everybody, which was, oh, crap. And then we got word that there wasn't going to be any more resources, and then I got on the phone. I called a few people who I know who live in Groveland. I said, hey, it doesn't look like there's any help coming. I know you guys know, but get the hell out of there. Because I thought things would turn out much differently than they did. So thank you to the firefighters. Thank you to Chief Cashy for somehow pulling in resources, however you guys did that. We, like Supervisor Rutherford said, we dodged a bullet, but we didn't dodge a bullet out of luck. We did it because we had some amazing people on the ground fighting hard. So thank you, CAL FIRE. Thank you, firefighters. And thank you, Lord, for answering some prayers. So thank you.
So I'll wrap this up. And Supervisor Gray, you said it. How far have we come since the rim fire? And when I think about the action that this board took a couple years ago with implementing After Paradise, our Fire Resiliency Task Force, and the committee, this was an illustration of how important that planning is, and bringing all of the different partners together, the volunteers, our staff, the different agencies. And we dodged it on this one because our success was really culminated in all of those efforts. And then we'll say that the weather worked with us too. We cannot be complacent. We still have a couple months to go of fire season. We need everyone to be doing their part, and I appreciate the evacuees also doing their part. When the call was made, by and large, they left in a very orderly, organized fashion. And so I personally am going to stand and applaud everyone who was in this effort. And from the bottom of our hearts, thank you, because this is how it's supposed to work. So thank you.
Madam Chair, Rebecca, Health and Human Services Agency Director. I feel compelled to remind the community that this evacuation also included having to deal with COVID. So I would like to acknowledge my public health staff, Michelle Jaquetta, Steve Boyack, for putting in very long hours on Saturday and Sunday. Thank you.
Thank you. And again, that is staff across the entire organization.
Good morning, Board. Andy Murphy, Assistant Fire Chief for County Fire. Certainly the mock fire was an example of coordination, cooperation, and planning ahead. And it's never good to be the last major fire in the state because you really it's a challenge to get resources. But fortunately, the state was able to come through with those resources. What I'd like to talk about briefly is I'd like to do the statistics and information for the monthly report that I send out. And at the last board meeting, I was with Chief Cashy in Napa before we came up here for the mock fire. And so just briefly, I want to talk about in the month of July, your fire department responded to 495 incidents. 353 of them were medical aids and 52 fires. So you think about 50, that's over, almost 2 fires a day. And then so far in the year, by the end of July 1st, 3,217 incidents in the jurisdiction of the county. Some other highlights from the month and from the couple of months of the summer. One of the grants that we've talked about in the past and applied for successfully the last couple of years is the California Fire Foundation grant in cooperation with PG&E and some of the other power companies around the state. We hired 2 part-time temporary defensible space inspectors that did the 100-foot clearance, basically the 4291 inspections for about 12 weeks, and they completed over 1,000 inspections. And it was really a positive, and I'll share that in the August report. It was really a positive experience for a lot of the homeowners. Were very happy to see fire folks and county fire folks out there performing those inspections. A lot of positive feedback and a lot of compliance. It was really a good program. Also, I wanted to highlight, we normally do a graduation ceremony, but because of COVID, we didn't for the volunteer firefighters. We had, after 7 months and 300 plus hours of training, we have 10 new volunteer firefighters that graduated in July, and it was a very positive, but challenging a little bit with COVID, but we got through it. The last thing I wanted to share, if you embellish me for another moment, is something we don't get a lot of, unfortunately, and it's a CPR save that happened on August 17th. The volunteers from Mona Vista and Engine 511 out of Mona Village and Tuolumne County Ambulance responded to a medical facility, and I'll read this report from firsthand. It said, the patient was at a medical facility for symptoms associated with a heart attack and became unresponsive. The resources were dispatched and the ambulance arrived at scene all at the same time. When we entered the exam room, the staff was performing CPR and had an AED, a bag valve mask, which is does the breaths, and an IV in use in the patient. The patient was shocked the first time as we entered the exam room. And this is from the firefighters. We relieved the staff performing compressions and airway management and prepped the area to facilitate transferring the patient to the gurney. While the paramedic administered the resuscitation medications, we did 2 rounds of CPR and administered an advised shock. No pulse was found. We resumed CPR at the paramedic's monitor, and the paramedic's monitor was attached. Shortly after the patient was transferred to the gurney, a pulse could be seen on the monitor. During the time it took to move the patient from the exam room to the ambulance, the patient progressed from following simple verbal commands to conversing in full sentences. And that night, after the patient was transferred to Adventist Health, the medic that responded had called the staff and advised that the patient was successfully transferred to an advanced cardiac care facility and was doing well. So I just want to highlight that. Normally, we might have the folks here with COVID. We couldn't, of course, just to acknowledge their work well done, the whole group. And that really is an example of the chain of survival that we teach in CPR, and it takes the whole community, from the advanced practitioners, the first responders, the volunteers, and the ambulance staff. And I just want to acknowledge their job well done. Thank you.
Thank you for that update. Chief, anything to add?
Well, good morning, Chair Brennan, members of the board, county staff, CAO Riggs. I just want to say thank you. When we were talking in the EOC on the 21st, the situation we were presented with was one that was unlike any we'd seen before in regards to almost 1.1 million acres on fire at the same time in the state, and us having our fire at the tail end of that. What your county staff did, what the sheriff's department did, the evacuations they conducted, proves that our county is ready to handle these situations should they arise. And it is a team effort. But more than that, those people that are on the line, they can't do it without the community support. And that's the motivation that keeps them going. So I just want to say thank you. And on behalf of them, thank you for continuing to support us.
Thank you so much. All right. Seeing no other staff reports, I'm going to beg everyone's indulgence, but we do have to go to our 2 closed session items before we can do our 9 o'clock appointment. We will try and move through them efficiently. And so with that, Heather, will you please read our 2 closed session items?
Closed session conference with labor negotiators Tracy Riggs, County Administrator, Eric Earhart, Assistant County Administrator, Ann Fremd, Human Resources Director, Kimberly Phillips, Human Resources Analyst, and Debbie Batista, Auditor and Controller. Authority Government Code Section 54957.6, all bargaining units. And closed session item, conference with legal counsel, anticipated litigation, Authority Government Code Section 54956.9, D2, 1 case.
At this time, I'd ask if there's any public comment. There is no public comment. All right. We are going to do item 16 first, and so we need to clear the room, and that is the anticipated litigation.
August 17th, 2020, August 18, 2020, and August 25, 2020 meetings. Item number 2, adopting Resolution 7920, approving the 2020-21 Tuolumne County tax rates pursuant to Government Code 29100. Item number 3, approving the notice of completion for contract number 1715-11, Italian Bar Road, Site 6, storm damage repair, and authorizing the chair to sign the notice. Item number 4, adopting Resolution 80-20, authorizing a local government planning support grant program, LGPSGP, Regional Early Action Planning Grant, REAP, application in the amount of $200,970 to prepare planning documents and pre-development studies that accelerate housing production, including Community Development Director Signature Authority. Item number 6, authorizing engineering staff to prepare and administer a federal funding application for pedestrian and bicycle improvements for the Jamestown Safe Routes to School project under the Active Transportation Plan. Item number 6, approving the reappointment of Linda King to the Oak Grove Cemetery District with a term to expire January 31st of 2024. Item number 7, rescinding resolution number 2019 and adopting resolution number 81-20, declaring 0.404 acre property of common land located in Block 6 of the Groveland Town Site and authorize county staff to surplus. Item number 8, adopting resolution 82-20, recognizing Suicide Prevention Week, September 6th through September 12th of 2020. Item number 9, approving an appointment to the Tuolumne County Board of Supervisors Planning Committee with a term to expire February 2021 due to the resignation of the at-large representative. Item number 10, adopting resolution 83-20, approving a final map for tentative subdivision map TSM 16-012 Eagle Ridge. Item 11, awarding a contract in the amount of $744,000 and $74,451 to Sinclair General Engineering Construction, Inc., to perform the work as shown in the plans and bid book for contract number 1715-12, emergency storm damage repair construction on Little Fuller Road, and authorizing the chair to sign. Number 12, approving a letter of support for Natural Resources Supply Concept JPA grant application and authorizing the chair to sign. Number 13, adopting Resolution 84-20 and approval of Schedule A and Amador Agreement with CAL FIRE for fiscal years 2020 through 2023.
Would any member like to pull an item?
I'd like to make a comment on one.
All right.
On number 5, I just want to publicly acknowledge that I have asked, in conjunction with that Jamestown Safe Routes to Schools project, I've asked our engineering department to work with TCTC on that to incorporate appropriate traffic calming measures as part of that project.
All right. See no other comment?
Move to approve the consent calendar.
Just a moment, please. First, I'd like to ask if there's any public comment. No public comment. All right, I have a motion from Supervisor Gray. Second from Supervisor Rotifer. All those in favor? Aye. Any opposed? Motion carries 5-0. Thank you very much. Will the clerk please read our 9 a.m. appointment?
(9 a.m. presentation and planning status update of the novel coronavirus COVID-19. As a reminder, public comments that were submitted in writing for this will not be read aloud, but they will be retained in the administrative record and have been forwarded to the Board of Supervisors.
Good morning, Madam Chair, members of the board. Rebecca Spino, Health and Human Services Agency Director. On Friday, the governor shocked us all with a new blueprint for a safer economy. To ensure Tuolumne County was ready to implement these changes, your public health team combed through all the new guidances over the weekend to ensure today's presentation provided your board and the community with the most up-to-date information. Today's presentation is rather robust, so without further delay, Dr. Ortiz and Michelle Jaquetta will take us through the changes. Thank you.
Good morning. Dr. Ortiz, Interim Health Officer. I should start out by saying today would have been my mother's 67th birthday. I didn't realize it was September because, as we all have experienced this year is flying by, and if you work in public health, we work crazy long days. So, in my mother's spirit, for people who know her, she would have expected me to act with integrity at all times. And so, let's get started. So, numbers as compared to the last time we presented on the 17th. On the 31st, the state of California and Tuolumne County have reported that Tuolumne County has 182 positive cases in residence. This does not include federal and state inmates. We'll get into that later. And as you can see, we've had continued significant increases in the number of cases and deaths across the state. This map shows where counties stand in terms of the blueprint. This was updated this morning since the state made some significant updates to their website last night. We had previously shown the counties sort of color-coded in terms of their case rate, which was what we previously were using as a monitoring list. But at this point, it shows the category based on the state's blueprint. So purple is the most strict level, and it is correlated with the highest case rate. And then red, orange, and yellow. So currently, Tuolumne County is in the orange level, which is moderate, and also we call it Tier 3. As a reminder to everybody, the orange level is less strict. We are now able to do more things currently at the orange level than what we were able to do in the previous week. We know there has been some confusion, and the state communicated with your board last night about the issue that did not just happen to Tuolumne County. Secretary Galley and State Acting Health Officer Dr. Erica Pond communicated with us that 12 counties were affected, and that according to their report last night, Tuolumne and San Francisco were given colors that were inappropriately lower than what is actually in accordance with their case rate. So if you had gone to the website yesterday or this weekend, you would have seen our case rate has always been above 1. And that until last night when they corrected it, it was erroneously showing as yellow. It is now correctly showing us at orange. As the Public Health Department relayed in their daily update and communicated with all of our JIC partners on Friday, we understand that there was a discrepancy on the state's part there, and we worked all weekend to clarify where the state was going to move. So every health officer across the state has vehemently advocated for doing these things correctly the first time and not sending these confusing messages. We will continue to request that of the state. We have a call at 5:30 tonight about the blueprint, where we will continue to advocate for giving businesses more notice and the correct information the first time.
Dr. Ortiz, before you move on, I think I speak for most of the county and probably most of the state. These criteria, these benchmarks, if you will, come out. This is now the second time, obviously, but the numbers. There's never any justification is too strong a word, but I can't think of a softer one. But there's never any published information on why the numbers are what they are. What are they based on? Is this just some numbers that they looked at it and they go, well, let's use a 3-number range from 0 to 3 and then 4 to 7. There's no explanation why the numbers are what they are. Okay, and as an example, we meet one of the numbers in the yellow category and we don't meet it in the other category, at least by my spreadsheet. Okay. And if I'm looking historically over time, the one that we don't meet, I believe, is, well, let me call it up. I can do that.
Positivity rate is in the yellow range. Case rate is in the orange rate.
Okay. The case rate has been, albeit incrementally, but fairly steadily increasing over time as our testing has been increasing, okay? So I don't see a way, as we continue to test, that anybody's going to get down to 1, okay? I just don't see that, except for the 2 counties that happen to be pretty much isolated from everybody else. So yellow, to me, that number, I'd like to know why that number is the number it is, okay? And the state has never shared that information. The other thing that I'm not sure that the community, and I'm talking the health officer community, is sharing with the state is what the impacts of some of these restrictions are to other aspects of our public health, okay? As we're shut down, and the more we're shut down, the more intense these impacts are, but depression tends to go up. You have associated things like domestic violence cases are going up, child runaways are going up, all of these things. So, when I look at that, I really need to know why those numbers, what is the justification for those numbers being what they are, other than the guy up at the CDPH decides that he likes 1 better than 2 or better than 1.5, or do you get what I'm saying?
I do. And we will address some of those details in the coming slides.
Okay. I hope so.
I'll also address a few things. The health officer community frequently, vehemently, at every opportunity, and we create more opportunities when we, are not given them, vehemently advocate for all aspects of the public health and how this pandemic is affecting other aspects of all of our more global, holistic health. We also vehemently advocate for these decisions being based in science. There is not somebody in CDPH who says, I like the number 2. They make these decisions based in science. And I'm happy to add more details about that justification, and I'm happy to continue to advocate to CDPH that they should make that more visible. It is on the CDPH website. We have pulled some of that into this presentation, so we'll mention some of it.
Okay.
And we'll continue to advocate for that, because the reason you have appointed physicians and scientists in CDPH is because we make those decisions based on the science. And the evidence shows that certain case rates lead to exponential growth of disease that is obviously far more difficult to control. So that's where those numbers are based off of. Additionally, we fully, this is basic epidemiology. We all know that once you start testing, you start finding more disease. We know that. And the expectation isn't that we will never have any disease transmission. The expectation is that if you're going to allow people to behave in a manner that increases disease transmission, that you should do that when your case rate is indicative of a level that will not lead to uncontrollable, exponential, rapid growth, which is what we have seen happen in situations where we had exponential growth in this county at the beginning of July. Thank God we have much improved case transmission. Our case rate is actually dramatically lower today than it was in July.
Absolutely.
And we have been testing at the same level, if not higher. The positivity rate is included in addition to case rate because you need to make sure that you have a low positivity rate. If you decide you're only testing 100 people and 89 of them are positive, that's a huge problem. You're not testing enough people. You're not getting an accurate sense of what the actual disease transmission is. And there is science to say that a low, these cutoff points for positivity rate, which are not on this slide, sorry, it's 10, 15 slides forward, and we'll get into it. Those case rates are indicative of whether or not you are accurately diagnosing and understanding the disease transmission. So we will continue to, believe me, we have the whole time.
I'll hold my comments, and we can get through the...
Well, I'm sorry.
Go ahead.
I'm here to present scientific information to you and the most accurate information that we have.
Okay.
And it is incredibly important for this community and your board to understand that the Public Health Department always accurately, transparently, as quickly as we possibly can, share that information. And that information includes that our transmission, our case rate is looking significantly improved as compared to July. And our test positivity rate indicates that that is a representative sample and likely accurate.
Okay.
We don't make these decisions lightly with any blasé attitude towards the obviously massive impact this has on businesses, the economy, the other aspects of health in this community. Public health has always advocated for improving domestic violence, substance abuse, suicide prevention. All of these issues are issues that public health have been working with partners on for decades. And we will never stop advocating for improving those aspects of people's health. We take incredibly seriously the weight of the decision to say, we're going to order something to be closed in order to prevent disease transmission. So I'm happy to be more clear about that information since you ask us to share that information.
Okay.
And in deference to our partners who work really hard with us, Shelley's got this one.
Good morning. As the pandemic is ongoing, we wanted to stress the importance. We will continue the invaluable partnerships with our local stakeholders and partners, as well as with regional partners. We join together for multiple calls weekly to coordinate on the response. The Yosemite Gateway Area Coordination Team composes of Mariposa, Madera, Merced, Mono, and Tuolumne counties, as well as the Yosemite National Park. The San Joaquin Valley Public Health Consortium also includes Calaveras County, Mariposa, and the Central Valley counties. The Region 4 Medical Health Mutual Aid Advisory Committee has at least weekly phone calls and coordination calls. Weekly meetings are continuing to be held with all of the county school districts and the county superintendent of schools. We meet on Thursday mornings. Bi-weekly meetings are held with the business community in coordination with Tuolumne County Innovation and Business Assistance. Our next webinar will be this Wednesday. It'll be tomorrow evening at 6 o'clock. Folks can register for that at tcdisasterassistance.com. They can email Cole Prezabella when the link is right there at the bottom of this slide. And now I'm going to have Dr. Ortiz going to talk more about our cases.
So this is a screenshot from our dashboard yesterday, which showed us at 182 cases in non-federal and state inmates. So this is a little bit higher, but we will get into some of those details here. So disease reporting into CalReady includes county, state, and federal inmates. This applies to all diseases. This has always been the case. Case rate calculations, however, for the blueprint, for the new tiered framework, do not include state and federal inmates. The county's data dashboard will be updated this week to separately indicate federal and state inmates that have been found to have lab-confirmed cases of COVID-19. Obviously, they still have a huge impact on the public health of this county. And also impact the staff members. So state prison staff cases are counted by their county of residence. So we'll have a separate category on our county dashboard that includes the state prison staff and inmates who have tested positive regardless of their county. And then just to make it clear that when the county's case rate is calculated for the blueprint, it does not include those inmates. And the California Department of Corrections and Rehabilitation do have this public website, which has their own dashboard, which applies to all of their facilities. So all of this information is publicly available as well. We'll just make sure to include it on our county dashboard for SCC so that people can see what's going on there. Regardless of what our current case rate is today, whether or not we're in yellow or orange, the actions required to lower disease transmission remain unchanged. Wear a face covering, maintain 6 feet of physical distance, minimize contact with people outside of your household, wash your hands and increase cleaning, isolate and quarantine as instructed to prevent disease transmission.
So a bit about testing. In Tuolumne County, at least 9,746 tests have been conducted. Testing is available from our local providers, Adventist Health Sonora and the OptumServe State Testing Site in Angels Camp. Adventist Health Sonora does have the capacity to do PCR testing on site, but due to overwhelming demand, that's limited to medically urgent situations. And all other PCR tests are done using send-out labs, and those have a longer turnaround time when they have to be sent out to a lab.
I have a question. What's the problem with the state's testing data? How come we haven't gotten an update this week yet?
The state infectious disease reporting system, CalReady, was offline. It was down yesterday, so we weren't able to pull new numbers for the total tests.
So we're 3 days in arrears, so there's probably going to be a big jump.
No,
when
it
we-
worked. It worked it was active during the weekend. It just wasn't available for us to pull the accurate number for the daily report. So hopefully that's back online this morning. I haven't checked.
Okay.
Yeah. And healthcare providers and labs are able to share with us positive test results, not through that system. So if we were made aware of a positive test, like there was a new case yesterday, they can share that information with us via fax or a phone call to give us a heads up if there are positives outside of that system. Testing continues to be available again at the statewide testing site at the Calaveras County Fairgrounds, operating 7 a.m. to 7 p.m. Tuesday through Saturday. Appointments are still strongly encouraged, and walk-in availability is limited but is available. Anyone can get tested at no cost. You can make an appointment at lhi.care/COVID testing, or you can call 1-888-634-1123. And if folks are experiencing symptoms, they should self-isolate, call their healthcare provider or the Adventist Health COVID-19 hotline at 209-536-5166. And also a website, valleycovidhelp.com, provides helpful information.
All right, so we'll get into a few details here, but we'll start a little bit broader just to give people the basics. The primary criteria for determining what category a county falls in are the case rate and the test positivity, as we spoke about before. As of August 31st, Tuolumne County is in Tier 3, which is orange or moderate. The state utilized our case rate and test positivity from the previous 2 7-day periods, so from August 5th to the 18th, to make that determination for what category they put us in, effective yesterday, the 31st. The basics of how counties can advance or move back are that counties can advance to a less restrictive tier when they meet those metrics for 3 weeks, which is basically an incubation period and enough time to report on that. To move back to a more restrictive tier, a county will have to meet the restrictive metrics for 2 weeks. And these are averaged over the course of 7 days and reported weekly by the California Department of Public Health. Our community's continued diligence and behavior in, as I was speaking to before, wearing a mask, physical distancing, et cetera, are those actions is what will help lower the rates and move us towards yellow. Obviously, one of the biggest questions is how does this impact schools? The purple tier is equivalent to those counties that were previously on the watch list or the monitoring list, had a case rate of over 100 on that 14-day average. So in that tier, with the exception of TK through 6 with waivers, there's no in-person instruction. Counties in the other tiers, which include Tuolumne County, are allowed to continue with in-person school instruction, provided they obviously follow all of the guidelines that have been put out by the Department of Education and CDPH, obviously including distancing and increased cleaning and a lot of other things that they have to do. So a few details that were pulled straight from the CDPH website. The link on the bottom, we've included in our daily update. We'll continue to point people to where they can find these details. We pulled out just we tried to make this readable. It's a lot of information on one slide. But the measures are based on indicators that capture disease burden, testing, and health equity. A county, of course, can always be more restrictive than this framework, but the framework notes signals of concern, including impacted healthcare capacity, that may lead towards dimming intervention. So CDPH will assess these 7-day averages weekly. The next time they expect to publish the rates is September 8th. If a county case rate and test positivity fall in 2 different tiers, the county will be assigned the more restrictive tier. And of course, this is completely replacing the previous county data monitoring metrics.
Can I ask you a question about?
I do have a few more slides that
Okay.
might answer them.
Go ahead.
So, to advance to a less restrictive tier, this does give you some more details. They are all available on that CDPH website. But again, as I mentioned, the expectation is that a county meets that metric for 3 consecutive weeks, and that the CDPH will establish other measures and include some adjustments for things like how much we're testing and if we're doing that in an equitable way to sort of better capture what we're doing. So in this case, we're testing at an appropriate enough level to know that we have a decent sample size, and that helps our calculation as well. And to move back into the more restrictive state, as I mentioned, if you meet those metrics for 2 consecutive weeks, the counties will have 3 days to implement sector changes. But of course, at any time, if any county is seeing impacted hospital capacity and other indicators of disease transmission, they can ask for assistance and mutual aid, of course, before they reach that point. So, how are these sort of categories made? Why are some things allowed to be open, at different levels? What is the science that shows, why it's reasonable to have something open in one way or not? All of these decisions are based on the following 7 criteria: the ability to accommodate face coverings, the ability to physically distance, the ability to limit the number of people per square foot, the duration of exposure, the amount of physical interactions, ventilation issues, and activities that are documented and known to cause increased spread, so singing, shouting, heavy breathing. So all of these things have been very well documented in the scientific literature to show that this is where we see increased disease transmission. So these are the criteria that we're looking at to determine, there's a big difference in putting somebody indoors with poor ventilation and they're all singing versus outdoors with the entire, ability to space out even more, and to obviously recommend that you don't do things like heavy breathing and singing. So that is the scientific evidence of why different activities are assigned different risk levels and how we determine when it's reasonable to do things indoors, outdoors, or what modifications are necessary. So this is just a quick screenshot of one of 5 pages of these tables. This information is available at that link on this PowerPoint. We've also put it out publicly in our daily update in our Facebook. And this was actually, all 5 pages were attached to the health officer order for people's reference. We will go into all sorts of details about these levels and what they mean on tomorrow's webinar at 6 p.m., the business webinar that we will be doing with Cole. So if anybody has any questions at any time, they're welcome to ask public health and participate in the webinar, or reach out to Cole or public health if they have any specific questions. So that information is all publicly available in multiple places. We hope people take advantage of looking at how that affects them. So just a quick update on behalf of Corey Allen and the Education and Compliance Division. To date, 256 complaints have been brought to the attention of the Public Health Department, which were about 135 facilities. They have conducted 96 first site visits and 46 follow-up visits. 88 of those complaints have been resolved. Approximately 65% of facilities were successfully addressing their complaints. An additional 11% were not applicable to the education and compliance unit, so not related to businesses. and they have 34 active facility complaints. They have had 17 requests for PPE or business-related expenses reimbursement requests that were submitted, and to date, $26,517 of reimbursement have been approved. So, business operating guidelines are available at the same website they've always been on, covid19.ca.gov/industry-guidance. tcdisasterassistance.com, which is Cole's website, guides people pretty simply to the correct place. And of course, everybody's always welcome to email or call the Public Health Department for assistance navigating the guidances or where people fall or what do they mean by 25%. We're happy to help them out with that.
Okay, just one more slide, just to reiterate the information on communications and how we're sharing information with the public. Our community or Tuolumne County COVID data dashboard is active. It's a weird, hard to remember bit.ly link there. So the easiest way to get to that is to go to the Tuolumne County's official public health website or our Facebook page where there's a link there right to the data dashboard where it's interactive and you can view the different tabs and the data over time. The Tuolumne County Public Health Facebook page, and again, the official Tuolumne County website, it's tuolumecounty.ca.gov/public health. And we still maintain our community resources portal, and that's bit.ly/TC COVID portal. Again, those links are available on the official county website or our Facebook page as well. And the public is always welcome to call our call center at 533-7440, Monday through Friday, 9 to 5. Or email us at health@tuolumecounty.ca.gov.
So I do still have a question. Mm-hmm. In all of the discussions in the public health community, has there ever been a consideration for the dynamic difference, and I'm talking sort of in conflict theory, not in conflict as in war, but conflict as in bumping into things. The difference between a county, and I'll use the city and county of San Francisco on one extreme, and I'll use Alpine County on the other extreme, of population density in this whole equation, not just case rates and everything else, but rural counties, people bump into each other less frequently than they do in urban counties. And I bump into a lot fewer people than my contemporary does in San Francisco just by stepping out of the front door.
We talk about that, and that's why we calculate case rates by per capita. And that's obvious.
That doesn't address it. I'm talking about population density.
So there are also other things we measure, if you will allow me to continue, sir. I really do want to give you this information.
Okay.
You can also, analyze mobility. You can analyze our cases happening in denser places. We have plenty of GIS data. We have plenty of cell phone data. We have census data that shows us where people are. And yes, there is an analysis in communities that are large enough to publish that. They can. Tuolumne County is not large enough to publish that for our area. Obviously, we're much less dense than the other areas. Obviously, we have seen that in major cities, it can spread very quickly. It's happened in New York. It happened in San Francisco. It happened in LA. Understood. That does not mean that rural areas are not being heavily impacted. We also have a different set of resources to respond. So, yes, we do have conversations about density, and that information is publicly available. And if you'd like me to include it in the next board update, I'm happy to. But we are still seeing huge outbreaks in different types of workplaces or, groups of people that aren't necessarily what you would consider urban and dense. There's a huge number of deaths, disproportionate deaths, and disproportionate hospitalizations among the agricultural workers. And yeah, there is a significant amount of scientific analysis about, is that happening because they are in a dense working environment? Is that happening because they are in a dense home environment? Is that happening because they're all in a bunch of 15-passenger vans to get around? So yes, we're very much looking into that. But that does not mean that a rural community can't have an incredibly high disease rate transmission.
Just a point of clarification, Dr. Ortiz. Now that we're underneath this new criteria, is it still being based on the case rate, the 100 per 100,000?
So
Is that still
the
part of
case rate is slightly different. It's averaged over 7 days.
Versus.
And it's considered the daily case rate. But essentially, yes, I mean, like, no matter what, it's the number of cases you have over a period of time per capita.
Okay.
So yes.
And then with the schools opening or not reopening, obviously nothing's changed. It's just a different model. But now we're opening. So prior to this change, we hadn't met the threshold. We still haven't met the threshold. So what's changed between then and now to where we're
Our
now?
case rate has gone down significantly from initially when the decision was made, we were right at that cusp, right? And then Cal Ready broke. And it took over a week, 10 days to figure out, is it back? And do we have the accurate information? And since that time, our case rate is significantly lower.
So that decision was based on that case rate?
Yep. I mean, so ultimately the decision about whether schools open is up to each superintendent and each board. What I share is the information I have at the time, right? So this is what I know about our case rate now and the set of rules that exist at that time. This, versus today. Okay. Here's our case rate now, and here's the guidelines right now. So right now, we fall into a category where we are very comfortably below the monitoring list. All of our data is consistently showing that we're accurately getting, the actual number of cases and getting lab reports coming across. We're comfortably in a much improved case rate situation. Not that isn't a risk. It still is, and that's why they take plenty of measures to try to protect children and staff and mitigate transmission. But we're in a totally different case rate level now than we were a month ago.
Okay. All right. Thank you.
If I do my calculation right, the 7-day case rate, average case rate would have to be 3. So we would have 3 in a 1 week period of cases.
Yeah.
To get the yellow.
We have a 12, God, it's 11. We have a 12 o'clock EPI meeting to go over we have to reverse calculate some things with the state, and we're talking with the state tonight at 5:30 as well. But yes, I mean, the rough crude calculation appears to be 3 within a week. There are some
4
adjustments.
would be 1.09.
Excuse me?
4 would be 1.09.
Yes. Yeah. Any other questions, comments?
I don't see any other board questions at this time. I'm going to ask if there's any public comment on this item.
Good morning, Board of Supervisors, Chair Brennan, and Dr. Ortiz. I'm Mark Plummer from the Sonora City Council, and I wanted to speak a little bit to this issue because it's been very disconcerting. The city has supported you, Dr. Ortiz, in your decisions and leadership across the board. But right now, I'd like to, give you a chance to explain to the public why, when the state said we were at yellow, you took it upon yourself to put us into the orange group, and much of the public, especially our businesses, feel be punished. And I'm certain that it's not arbitrary and capricious, but it looks that way. I'd like to give you a chance to address that. And then I had another question, and that was, I couldn't see the screens very well. How many weeks that we will be going forward before we can conceivably be on the yellow again? Then lastly, why do we constantly give the results for all of the positive tests every week? Because functionally it seems like saying, well, we have 20,000 cases of cancer, but only 200 that are active. It seems like a measurement that's just designed to create fear or panic when in fact we only have I think the number is 10 people now who are ill. I'd sure like to hear the answer to that. Thank you very much.
So I can answer two of those number questions very quickly, and then I know Korea wants. Sorry, thank you. I can answer two of those questions, the numerical questions, very quickly, and then I know County Council would like to respond. So the first one is how many weeks we can anticipate being at this level before we could potentially move into the yellow level. And the state has stated that it will be 3 weeks before a county can potentially advance forward to a less restrictive level. And I will also point out that the county data dashboard and the daily update, which is also shared as a press release and included by major media in the county, all share the total number of cases, the total number of deaths, the number of recovered cases, and the number of active cases. So yesterday's daily update included that there are 10 active cases.
There is one other piece of data that I would be interested in, and that is how many of our active cases, I'd actually like it for total cases, but that's probably too hard to do, but how many of our active cases are asymptomatic? Mark Plum,
so we can address some of that, and it's very hard to do because it changes over the course of the disease.
Sure.
So.
But Mark made a comment that 10 people are sick, and that sounds like, they're laying in bed and coughing and wheezing, and some of those are just isolating because they tested positive. They don't have any symptoms.
Right. So the other thing that is included is whether or not people are hospitalized. So.
Okay, so 2 points. I'd like, Sarah, could you please address his first questions? I know we had that in the beginning of the presentation, but I think it's worth repeating because I know I was under certain misperceptions over the weekend also.
Sure. So last week, Dr. Ortiz was actually on vacation, probably the first one that you've taken since you have been interim health officer. And we had a neighboring health officer covering for her while she was out. That neighboring health officer contacted the state when there was pointed out a discrepancy in the numbers, and then the state clarified that, yes, the discrepancy was accurate. I have that in an email string, so it's very clear how the communication happened. So I want to make it very clear to the public that Dr. Ortiz was not contacting the state because she was not working at the time when this discrepancy occurred. However, as health officers are their work is under the Health and Safety Code, mandated working with the state, it's not unheard of that they would have those communications with the state given the issues.
Can I clarify one other thing on that too for the public? Okay, the county is not being more restrictive than the state on this. The county just clarified what the actual numbers really are. The state has had numerous data problems. So it's an integrity issue to make sure that the numbers are what they are. It is not Dr. Ortiz or anyone in the county telling the state that, no, we're going to enforce orange, not yellow. So the state's numbers were just wrong. And unfortunately, they published the results of those numbers before we could get them corrected.
Just as a point of clarification, and I did come back early to deal with this. The state published the case rate, and the number was always over 1. they mislabeled the color on the map. And it took them a few days to be able to make that correction for us and 11 other counties. We shared, and will always continue to share, we identified a discrepancy and asked for clarification. And as soon as we received written confirmation of what the state decided for the state's criteria, we acted on that.
Supervisor?
Just a quick question, since we were talking about numbers. Do we know how many ICU patients we've had locally?
So there's two different issues with the ICU. Some of them are our county residents, some are not. We have sort of our own line list of, whether or not people were hospitalized over the course of their admission. It's really difficult to parse that out because it changes over time. And so we receive daily updates from the hospital in terms of where we are with ICU status and where we are with hospitalized people and which of those are in the ICU, but that changes super frequently. It's very, very hard to go back into each individual hospital record to stay accurate with that. We've tried to find a way to be able to include that daily, but it is very difficult to be up to date on that because it changes so quickly.
Okay, but this whole surge plan was based around the ICU.
Yeah, so we know the ICU capacity at all times. And, that is shared every single day across the state, every hospital. And that's shared on a state and a regional level, but then our one hospital also shares additional information with the public health department so that we can sort of see that coming ahead of time. So there have been times where our ICU has been at capacity, a lot. But so we publish some of that data is the state publishes from the state polling, which is the most accurate way to get that daily update out.
So we've had 180, do you know, Michelle, 180?
So including 182, not including the recent inmates.
And we're saying I have 182. We don't know how many of those have been in ICU.
So it's complicated to get that information accurately. So we know to find out are they hospitalized? When do they get discharged? Requires us constantly asking the hospital to tell us for each case. And people can be put in the ICU and then, stepped down. So we continue to try to find ways that we can just daily report that, but it involves an enormous amount of work and going through hospital records on every single case all the time.
Well,
right.
You know how many are hospitalized?
Right.
Do we know? Yeah. I'm just saying as average Joe up here, I'm not a doctor, that's a pretty key piece of information. The fact that we don't have that is pretty.
So we're happy to share that with you in today's daily update. Okay. We'll pull that out of the reporting.
Maybe get that?
Whether or not we can, and the hospitalization data is always put in on the daily updates for what it is that day. Whether or not we have the GIS staff who can then go back and put that information, I don't know.
I don't know how to get the information. All I know is for me, the big picture, the surge plan, the hospitalization, I get it. But again, if we're talking, when we say ICU, we also know, the hospitals have been bringing in patients from out of county.
Right.
To
which
share
is why
resources,
we couldn't just go with the polling.
Which I totally get. But
Yep.
for me, it's, if 182 of those, if only 2 of them ended up in ICU, well, that's pretty telling versus if 80 did. Because to me, that tells me, well, maybe the majority is very systematic. Maybe the majorities didn't show up. I mean, those are the most key important pieces of information for me, and yet we don't have any idea about.
Yeah. So
reporting that.
We've been working with the GIS team to get more information on our dashboard, and hopefully we can get those updates out this week. As you know, they've been deployed elsewhere and they're not staffed at the level they've been before. But we've been working out ways to see what hospitalization data we can put out there. So we will continue to.
Thank you, but we're 6 months into this. We should know how serious this is on our local ICU and our surge plan. So I would really appreciate if we could get some conversation going with the hospital, so I know what our ICU.
Okay.
Yeah. So we'll include that in today's daily update for you then.
Thank you, Dr. Ortiz, for that inclusion. Rebecca, I just want to, again, because Councilmember Plummer raised concerns from the city, and I think we did say publicly a couple months ago, or maybe 6 weeks ago, that if the city council wanted to have some kind of update from the health department at their meetings on the first and third Monday evenings, that we could do that. And so I would just put that out there again, that if they were interested in that they could reach out to you, and just so someone was available to answer questions with the best information available. Again, put that out to Mayor Hawkins and the other city council members. And looking for confirmation on that, and I see you saying yes. Thank you. Okay. We had public comment. There are no other board questions at this time. So thank you very much for the presentation. Remind everyone of the webinar tomorrow evening, the business webinar. And in the presentation, the contact information was there, or reach out to Mr. Presbola if you're looking to join that webinar. Thank you. Okay. I have sincere apologies, but this board has to go back into closed session before we can do our 10 a.m. appointments. Do I need to have...
Can we do the visionary home builders one?
Well, we have a number of staff here. I'm thinking closed session is going to be very quick. Visionary home builders they know that they probably will not be until after lunch. They've already been contacted on that. Thank you for that confirmation. Do I need Heather to reread the closed session item?
Conference with labor negotiators Tracy Riggs, County Administrator, Eric Earhart, Assistant County Administrator, Ann Fremd, Human Resources Director, Kimberly Phipps, Human Resources Analyst, and Debbie Batista, Auditor Controller, Authority Government Code Section 54957.6, all bargaining units.
And I will ask again if there's any public comment on this item. There is no public comment. Appointments until 1:30. We are going to take item 17, and I want to remind the public of the call-in procedures if they want to comment on this item. Please.
If the public wishes to comment on this item, they can call 209-533-6581 to join the queue.
All right. Will the clerk please read item 17?
Supervisor Kirk, consideration of developing a board committee on COVID-19.
All right. So before I read the memo, I just want to go over a few numbers, and then I'll lead into what it is I'm proposing. Just yesterday, news from CDC was released. 94% of COVID deaths had underlying health conditions. 6% died from the virus alone. If you break those numbers down, that means 9,683 people died from COVID alone. The death rate for the United States is 0.05548% in total, and the death rate specifically for COVID alone is 0.00304%. In California, there's been 12,905 deaths. Out of 39 million residents, that's 0.0333%. In Tuolumne County, approximately 53,000 residents, we've had 2 deaths. That's a death rate of 0.00377%. Economic impacts locally. Prior to COVID-19, our unemployment rate was 4.5%. Since COVID, the average unemployment rate has tripled to 14.5%. On July 21st, Cole Prisabella, the Director of Innovation and Business Assistance, stated that the personal paycheck protection loans covered about 4,452 jobs which were retained because of those loans. I want to remind this board that those personal paycheck protection loans are no longer available. Worst case scenario, we could have looked at a 37% unemployment rate. I think that's pretty exaggerated since the state unemployment rate is 15%. Nonetheless, had those loans not been available, it could have been devastating. Again, I want to remind the board those personal paycheck protection loans are no longer available. Mental health. The Johns Hopkins Bloomberg School of Public Research showed that there's a 300% increase in mental health issues since the lockdown began. I recently spoke with a family counselor who said since COVID-19, the lockdown, suicide attempts among our youth is up here drastically. Divorce rate is up, domestic abuse rate and violence are up extremely high, all locally. It's hard to get an appointment to meet with her because she's so busy. Routine medical checkups. The Prevent Cancer Foundation found about 35% of Americans have missed routine cancer screenings due to COVID-19 fears. Additionally, 43% of Americans have missed medical appointments. I recently spoke with a doctor who has worked in such places as LA, New York, Texas. He's traveled and followed all the COVID hotspots. He agreed, and again, I spoke with him personally, he agreed that Tuolumne County, a rural county, should be treated differently than other counties such as urban. The mere fact that we are a rural county greatly plays into the mitigation of spread. I recently spoke with an epidemiologist who stated that there is more to public health than COVID-19 in reporting numbers to the state. Again, I want to remind this board the numbers. When it comes to deaths, everything falls below 0.055%. Tuolumne County alone is 0.0037%. But then we have numbers like unemployment, which have tripled, mental health issues, which have increased by over 300%. We have suicide attempts. We have tons of behavioral health issues happening locally, which again are part of public health. I don't think it would be fair for me to say that our local public health division doesn't care. They care a great deal about the local public health issues, but I think it's a fair assessment from where I sit that they have been tasked with a burden of tracking this COVID-19 issue, doing tracking cases, and I think they've been overwhelmed with trying to meet state mandates with reporting. Nonetheless, there is a very big part of public health that is rapidly increasing and which is drastically affecting our community. So it is because of those numbers that I read, the 0.0% versus the 300%, the balance that appears to be completely off level, that I'm recommending that this board create a committee to look at COVID-19. So I'm going to read from the memo. It states, the residents and businesses of Tuolumne County have sacrificed so much in the name of COVID-19 surge planning. The surge plan, based on the WHO model, indicated Tuolumne County would have 5,000 infected, about 500 hospitalized, and around 100 to 150 dead by mid-May. To date, and this was last week when I wrote this, so I understand the cases have changed, but when I wrote this, there was a total of 179 cases, 166 have recovered, 11 currently active, 1 in the hospital, and 2 deaths. One of the deaths had underlying health conditions. The shelter in place was to give surge capacity to our hospitals so they could deal with COVID-19 patients. It was not put in place to defeat COVID-19 or wait for a vaccine. COVID-19 is real and it has damaging effects, even deadly to certain individuals. But just as the virus has evolved, so has the research, the treatment, the data, and overall awareness of the virus, which has and will continue to impact how we mitigate the effects of COVID-19. However, none of this is being discussed or given consideration at the local level. And if it has, it hasn't been done publicly. There is no doubt our residents want to keep the virus out of our community, but at what continued costs? What are those costs? I shared some of them with you this morning. And are they being evaluated as part of the overall public health? Suicide attempts are up, divorce rates are up, domestic violence, drug abuse, alcohol abuse. Businesses are being forced to close, children not being allowed to go back to school, which is forcing parents to stay at home and not work. This is creating a social and economic downturn which has continued public health ramifications. Therefore, I propose Tuolumne County, specifically the Board of Supervisors, approve the formation of a COVID-19 committee comprised of local private doctors and healthcare providers to evaluate data and research specific to COVID-19 and the overall local public health issues it has created. This committee will provide unbiased data and research for the board and the public at large to make informed decisions moving forward. I'm sure we're going to open this up for discussion, but off the top of my head, the way I see this committee being comprised is again of local doctors, possibly a psychologist, epidemiologist, a family counselor, and a school counselor, so we can take into consideration the complete impact that this shutdown is having on our economy and have that data. And where that data will lead us, I don't know, but it'll help us as board members to make informed decisions moving forward. I can present information that I find in research, but again, I think things have been so politicized that it's important that we get healthcare providers to research, to have this conversation, and to present this information simply as information for this board to try and make wise decisions moving forward. So, thank you.
So I'll open this up for consideration, comments.
Madam Chair, I'm in support of this, and here's why. Okay, we have never, as a society, reacted to any other pandemic, and we've had pandemics, the way that we have reacted to this virus, and I'm not sure what the difference is. I supported shutting down initially because we didn't know a whole lot, and it was spreading very, very rapidly. I agree with Supervisor Kirk. The purpose of this shutdown, and I'll remind you of the slogan, flatten the curve, okay? Well, we flattened that curve. Yeah, it's bouncing around, but it's bouncing around generally downward, okay? We need as a society to learn how to live with this virus. And I'll go back to the comments that I made when Dr. Ortiz was here about there's no consideration, and her protestations notwithstanding, I don't believe there's adequate consideration given to just the interaction. Again, I call it conflict theory because that's the way I was taught. But when you've got 52,000 people, it's not just that's roughly half of 100,000. We've got 52,000 people on 2,200 square miles in this county, okay? San Francisco has, I have no idea what their population is, and a very small postage stamp, okay? You walk out of a building in San Francisco on a normal day, non-COVID, shutdown, and you can't go 6 inches without coming within 6 feet of multiple people. And I can come out of my house. I could walk all the way to work here, which is about 3 or 4 miles, and not interact with anywhere near that number of people, not even come within 6 feet of perhaps anyone, okay, for more than maybe a second or two. Those things are not being factored in. When the number is 1 or 2 for Tuolumne County, and it's the same for San Francisco, the percentage or the probability, just pure probabilistics, the probability of me encountering people in our environment is not the same as it is in San Francisco. And that's not being taken into account. I think I see 2 purposes for this. One is to give us the information that Supervisor Kirk sees, but I also would like to see it as a body that can make influences in the public health system and how we better determine how we manage this disease in the greater context of overall public health. So I think I see them as a body that can provide influence as well as advice.
Supervisor.
Question for County Council. The mention of forming this committee, there's a process that we...
Is your mic on, John?
I'm sorry. There's a process that we go through to develop a committee, and I'm not sure if that's in ordinance or code, but we advertise for the individuals, and then we go through the process of pick and choosing who we want to be on that particular committee. We don't willy-nilly put somebody out there. So that would be one process that we would more than likely go through. I've mentioned that I'm not in favor of forming committees unless I can see a definite outcome, and I'm just not clear on what the outcome that Supervisor Kirk is wanting other than more information. Now, I don't believe, you can correct me if I'm wrong, from a government position that we create a committee. What standing would that committee, that's my basic question, what standing would that committee be in the eyes of the government that we are working on right now?
So from what I understand, this type of a committee would be providing information to your board. I'm not sure if it would provide recommendations to your board. Normally, when your board creates committees, you usually approve a work plan for the committee, and you then get recommendations from the committee for your board to consider actions to take.
Supervisor.
Yeah. CAO Riggs, how much staff time do you think this will take?
In the beginning, it could take a significant amount of staff time because obviously we need, if your board does create this committee, you'll need to let us know the number of members you would like, how those members would be selected. We would then put it out, post a notice of vacancy, do the applications. Our staff would bring it back to you, and then we could do our first meeting. And then the meetings would be staffed by our office. So we would have to post those agendas. They have their Brown Act, all of those normal protocols are in place. We take minutes and we work with them. So I can't give you the number of hours. In the beginning, these types of committees always take more time than once we get them going, just because the time of really pulling everyone together, a common goal,
and getting them coordinated as to what it is they're going to address. So I would say in the beginning hours and probably several hours each month after that, anywhere from 3 to 8, just depending on how much they do and how active they are.
Okay, and in your view, do we have surplus staff capacity to perform those types of functions?
None of our departments have surplus staff capacity.
Okay.
So.
And I can't help but notice that the job opening for a public health officer is still open, and that we've had an interim public health officer for, I guess, 5 or 6 months now. Is that search continuing? And I guess I'm just worried that we're taking time away from the important task of finding a permanent public health officer and applying it to a new government bureaucracy, essentially.
They're actually two different. So within oversight of the county administrator's personnel, but that would be Ann and Kim. So Ann and Kim and Rebecca and Michelle will be spending the most time in getting, maybe if we look at a recruiter or how we continue that search. It's direct staff in our office on the 4th floor, both my office as well as county council, that would be affected specifically to create and to sustain any additional board committees.
Supervisor Campbell, can I add one thing? This would also be a Brown Act committee because your board would be forming it. So then that comes with another level. It goes to Tracy's point about the staffing of it because we'd have to agendize it, et cetera.
So what's the earliest that we could have the first meeting of a committee of this type? Or maybe not what's earliest, but what's feasible?
The earliest would probably be about 6 weeks.
Okay, so a month and a half out.
Right.
Before we're able to take any action in this
And the
regard.
reason is you have to tell us today, we have to post it. I don't know if we would have enough individuals ready for your board to appoint by the next board meeting, which then pushes us out to the October board meeting. And then after that, then we begin working with them and identifying a time that group could meet. So anywhere from 4 to 6 weeks, I would say.
4 to 6 weeks, because my assumption is that people would be interested in this.
It's very possible, yes.
We know from the outreach that we're getting.
It's very possible.
So
And are you aware of any other counties that are taking a similar
I want to speak
action?
to that. I'd like to speak to that question specifically in a minute, because I've done some outreach and have some responses back. Do you want me to talk to it now?
Sure, that was my
Because COO Riggs and I have been talking about this since this item is up, and just got actually an email back, and this one was from Darby, I think, CSAC. And I'll scroll all the way up, but basically, she is suggesting that, yes, she is aware that other small counties are considering ad hoc committees to help with this because they cannot afford the data teams that are necessary to make, and this again, now I'm paraphrasing why I would be considering something is if we are going to make informed responses to the state, looking for them to actually respond to a list of our suggestions. Those have got to be highly informed items. And so when I hear her say that other small counties are considering ad hoc committees to help with this as they can't afford epidemiologists and data teams. So they are watching this, have not heard back from RCRC, but I have to suspect that they are also, I am actually aware of 4 counties that spoke out in the Yosemite Gateway conversation that were very concerned around this. Madera, Mono, Mariposa all spoke out very loudly at our last meeting about their concerns around some of the issues that have been raised by Supervisor Kirk and Supervisor Rotifer. So, yes, I believe there will be some organization. I can't tell you how that's going, what that will look like. And because these conversations, they're very early. And so given the challenges that we have with staffing, because they are real, we know they are real, but yet wanting to participate and look for ways that these conversations can be happening. And I actually believe that if we are going to effect policy, which is, I think, what we're really trying to do here, that is going to be much more effective if it is a coalition of counties and not just Tuolumne County.
I would agree, and I just want to add something else here. And Supervisor Campbell brought up the fact, that we are looking for a permanent health officer, and I do know that in the search for ones before that we were looking for someone that would be capable of working with the community, with the hospital, with doctors to develop a better relationship. It would seem to me that a committee like this would be good, but based under the health officer as guidance, because we can get all information. It's easy to get information. Just Google COVID and you've got 333,000 different articles that you can read on COVID. I think the other day when I Googled it, but we need it more specific for us, like you said, and I'm not disagreeing with the concept. I think just the timing and the way to manage it is and make it work for us is the important thing, and at giving it to the staff at this time, knowing how busy they already are, we all know that. I would propose doing a staff exercise, giving them more work to do, or a Supervisor Kirk exercise. Maybe that would lessen the burden of really defining, A through Z, what this committee would be comprised of. You made some mention. How it would be formed, who it reports to. We do know it's a Brown Act requirement, and take that approach. I'm not disagreeing with you. I just can't even see how we can do it. I also agree with Supervisor Brennan's approach of the regional approach. Does give us more power. It's obvious if you look at the last legislations that was passed and wasn't passed. CSAC and RCRC did a really good job of knocking down some of the things that would not be good for rural counties. So that's where I'm at right now.
So I'm going to go to public comment in just a minute here, because I know there's some public that would like to talk to us also. But I would like to consider asking probably Supervisors Kirk and Rotifer to come back with what a little more structure would look like and what you see as some of the goals of this committee. Looking to both of you to see if you would be interested in taking that on. I see a thumbs up from Supervisor Rotifer.
I do. I have a question, though, for clarification regarding staff time. Can we use CARES Act funding for any of this since it's COVID related?
I can't even see how to make the nexus to this. That's why I was looking over at Sarah, and I know we have Debbie. I just can't. I don't think so.
Okay.
I don't think it would pass an audit. I think OIG would not see that this is a direct impact. It's something that it's more of a wish list than a must-have, I guess is the difference.
How many individuals, because you brought up individuals for the committee, how many does it take to comprise an ad hoc committee?
So I'm going to ask you and Supervisor Rotifer to look at that, because again, the makeup of what you would be proposing would be specifically, I would think, in the potential frameworks.
Okay. And one more, Chairwoman Brennan, you brought up ad hoc committees. I don't see anything here that says we're talking about an ad hoc. Is that what's being proposed?
Specifically looking for the formation of a COVID-19 committee, and then he had some thoughts. I am asking these two individuals.
I think it fits the parameters of an ad hoc committee. We did one similarly for the general plan update. Ad hoc. Rather than try and articulate it myself, I'll let County Council articulate what an ad hoc committee is.
Sure. An ad hoc committee is just 2 board members for a short period of time on a specific task. But what I'm hearing is that this board is forming a committee that will be made up of different types of individuals. That makes it a Brown Act committee.
Okay, thank you.
Yeah, and again, I'm going to ask the 2 supervisors to work together and bring some proposals back on what they would be looking for. At this time, I'd ask if there's any public comment.
Hello, thank you, first of all, for taking my phone call. My name is Mary Whitehead, and I really am encouraged by Supervisor Kirk's comments. It sounds like a great plan, and it's encouraging. Thank you, first of all, for taking my phone call. My name is Mary Whitehead, and I'm encouraged by Supervisor Kirk's comments. It sounds like a great plan. Okay, so I think I'm muted on my TV now. So I have a question for the board. Dr. Ortiz stated earlier on one of her slides, if I followed this correctly, that there are still 37 facility complaints that have been unaddressed. Understand that. I know it's crazy times. My question is, since 5 or 6, I do not know the exact number, very sick patients were transferred from San Andreas Avalon facility to Sonora Avalon facility, where my mother has been for 3 years and 8 months, and we had 0 positive cases at our facility in Sonora. Upon calling public health to ask how this happened, they told us it was not authorized by them. It won't happen again. They will not be bringing more sick COVID patients from other facilities to our Sonora facility. My question is, who is going to enforce and oversee this situation at a dire
place
Mary, with sick people?
I appreciate the question, and I think staff has heard it, but that really is a different item than what we're on. And unfortunately, our public health team is not in in the board chambers at this time. So I can't possibly answer that. And again, thank you for the call and appreciate your initial comment about support of this concept. Is there any other public comment? Are you timing?
Live now? Yes, good morning. My name is Richard Kessler. I'm a...
Please mute your speakers.
I fully support Mr. Kirk's, Supervisor Kirk's proposal. I oppose...
Please mute your speakers.
Supervisor Gray's comment. I believe the outcome is clear if we look closely.
So can I address the caller? If you could mute, I think, whatever you're listening to us on, because we're hearing a lot of feedback.
Okay, is that better now? I didn't know I had it on.
Yes, that's better. Thank you.
Is that satisfactory now?
We can hear you.
Yes.
Okay, so if we look closely at Supervisor Kirk's proposal, I think the key central point, especially in light of Supervisor Kirk's letter to Governor Newsom, is that he is seeking local private doctors and health care outside the auspices of the board I think this is very important to have local input from, say, my doctor who knows me or my neighbors, and not have it connected. It's not a bureaucracy. I object to that comment also, or oppose that comment also. I believe it would be a citizens committee, is what Mr. Kirk is seeking, if I'm not incorrect on this thing. And I think this can be put together in a week or 10 days. I have already spoken to my doctor about this issue, and he's willing to become a member of this committee immediately to provide local input, and I think that's the key. So therefore, I think if the board would take into consideration Supervisor Kirk's letter to Governor Newsom, I think there's sufficient evidence to have this committee go forward, but let's not make it about a bureaucracy. Let's make it outside the box and have it local, the local individuals, not someone who works for the county. Thank you very much for your time.
Thank you. That's all of the public comment. All right, so I'm looking across the dais for acknowledgement that Supervisors Kirk and Rotifer are going to work on this and come back.
I just have one more comment, and it's kind of a concern that we're creating it is by definition a bureaucracy. It's a government organization that will have political appointees, and my fear is that we are creating the perception that we don't like the answers that we're getting from public health, and so we're setting up another organization in the hopes that they will give us the answers that we want. And that's not how medical science should work and how public health should work. And another fear that I have is that we are fooling the public into thinking that the county is taking substantive action toward reopening in opposition to some of the state guidelines, when in fact I don't think that we are. So I would just say that we need to be very careful about how this is comprised so that we are following medical science and that we're not creating another agency that will further create confusion, further politicize this disease that's already been very politicized, I think we'll all agree, and sowing more confusion in the community. Those are my concerns, and I really have some misgivings about this.
Okay, thank you. And before we move on, because with anything, of course, it would take a vote of 3 supervisors to approve anything that would be brought forward. So with that, we are going to stand in recess until 1:30. Thank you.
So we're going to vote when we come back?
That'll all be up shortly, but I'll get going here. Good afternoon, Board, Madam Chair, members of the Board. My name is Jason Terry from your County Administrator's Office. This item here today is to ask for some direction regarding the Coronavirus Aid, Relief, and Economic Securities Act, commonly referred to as the CARES Act. Here in a moment, I'll go through a couple brief summary slides of CARES Act, what eligible uses are, and some information just to refresh ourselves on that, and then we'll go over some of the expenses that have been spent under the CARES Act, as well as a forecast into the future. We'll be asking for some direction towards the end, and we'll get into more details as we move on with that. There we go. All right. So what we commonly refer to as the CARES Act is a much larger bill than what we're usually actually discussing. The CARES Act created the Coronavirus Relief Fund, and that's mostly what we're discussing when we talk about CARES Act in here. And that was $150 billion. It was to go to state, local, and tribal governments. Large cities and states, of course, received direct allocations. So like California received $15.3 billion. Smaller jurisdictions, such as Tuolumne County, received a sub-allocation from the state. And in our case, we received approximately $5.6 million. So, written into the Act, the CRF, the Coronavirus Relief Fund, can only be used to cover expenses that, number one is necessary expenditures. Now, there is no written out definition of what necessary is. It is incumbent upon local governments to make that determination and then be able to justify it if and when federal audits come on the tail end of this. And necessary expenditures in respect to response and recovery from COVID-19. These are expenses that could not have been accounted for in the budget when this all kind of kicked off and got going. The date they have here is March 27th. And then, of course, the expenses had to be between March 1st, 2020, and it ends, at least at this time, December 30th of 2020. So just scrolling through some of the guidance documents, we highlighted some of the called out eligible expenditures under this funding. So, for example, payroll expenses for public employees that are substantially dedicated to response and mitigation of COVID-19. I won't go through every single one here, but you can see up here, obviously, contact tracing expenses, grants and short-term loans to businesses have been called out, as well as currently, there's been some back and forth on this, but the current guidance that was put out August 10th is that these funds can be used to match FEMA Stafford Act funding. And as well as payments to nonprofits, and I have a note here that nonprofits may be used to distribute assistance. Regardless of how the assistance is structured, the financial assistance would have to be related to COVID-19. So some of the things that are not eligible are specifically called out in the guidance. One we know very well, the revenue replacement. We've talked about that multiple times. This also comes in the form of property tax relief. So by providing that payment to folks, we would also be receiving that revenue back, and that's a no-no according to these documents. As well as stipends, payroll or benefit expenses for employees whose work duties aren't dedicated to COVID response. Rural broadband capacity, I have an asterisk there. It's such expenditures would only be permissible if they are necessary for the public health emergency. So that there is a little bit of a warning there from the Department of Treasury that there would be a lot of scrutiny if we were to go that direction. And then, of course, across the board, hazard pay, just if we were to determine, or if your board were to determine that, every employee would receive X amount of dollars as hazard pay, that would not fly. So what we have here, this is a table. These are categories that were put out by the state. So this is the report in which we had to submit to the state. I believe this one had to go in July for last fiscal year. I'm looking for clarification on that.
The first report is actually due this Friday.
Okay. Yeah.
What you're looking at here is the actual expenditures as part of the report, they want everything through June 30th. These are the actual expenditures through June 30th.
Thank you. And so you can see some of the items that were expended through last fiscal year, kind of keep it at high level here. And as we get towards the future and forecasting, we'll kind of dive into detail of what these categories look like and what's included in them. Here on the next slide, we thought it was important to kind of note some of the direct operational I would hesitate to call them savings, but these were expenses that under normal conditions, with folks not being diverted to the COVID response, this would have been part of expenditures borne by the general fund, health funds, other funds. But because of the COVID redirecting of folks and some of the additional requirements that were brought on by COVID. You can see the general fund right there, $300,000. That was offset by the CARES Act. At Health and Human Services Agency, $88,000, and other funds, $24,000. So all said, a little over $400,000 in direct operational savings there. This table has changed. This table was as of last week, and there's been some significant accounting done in the meantime as we work to close out August. So that the expenses here have just about doubled, I believe, as we more than doubled in the costs that we've had in July and August. And you'll notice that these categories are the same ones that were on the first slide, the state categories that were put out, and include the PPE grants for businesses, payroll for employees that are substantially dedicated, and whatnot. So here's some of the potential future uses. We know that there's going to be some ongoing, continuing costs when it comes to COVID response. We're going to continue having personnel that have been diverted from their normal operations to COVID response operations. We're still going to have the contact tracing. We're still going to have those types of costs. Also, one of the things we're trying to focus on with CARES Act is improving. It says telework here, but really virtual opportunities, not only for employees, but also for residents. Is there a way that we can improve some of our systems so that rather than trying to go, say, having a digital resource that can be provided to residents upon request in a virtual manner, rather than having to come into a building, find a paper document, and provide it, would be one singular example of that. And what will be a little bit more robust of a discussion here in a couple minutes would be the economic support options. And those take the form of business grants, contributions to private nonprofits, and then also an additional discussion about trying to partner with an external agency to provide broad benefits of child care to the community as a whole. And then, of course, we have the other employee and liability type expenses with unemployment, workers' comp, and FMLA. So once again, this is a forecast, but with the changes in the actuals, obviously, the forecast is affected by it as well. So as more money has been used in the past, there's less money in the future. So we'll see the total numbers here changing. But over the next couple slides, I'll kind of detail what some of these numbers are here and how we came to them, and ask for additional direction from your board. Business grants. Business grants, private nonprofit, and the child care. We have proposed before your board today would be to use about $2 million of the CARES Act or coronavirus relief funds to fund the following types of opportunities. So one of the first proposals is expanding upon business grants from just PPE to acknowledging that additional expenses have been brought on by businesses as they're trying to adapt to taking their business outside, or trying to adapt to lesser capacities that they can handle, or trying to adapt to the virtual model. Allowing and building off of the platform we already have so that businesses can submit their expenses to us. It would still have to be a reimbursement-based model, but would be able to recover some of those fees that they incurred trying to make it during this COVID environment. So right now, the proposal there is $1.5 million. One of the things we have discussed, but looking to your board for direction for, is should we establish a cap on that if we were to move forward? If your board is interested in moving forward, for example, a $10,000 cap, that means about 150 businesses can receive help. $20,000 cap, 75, and of course nobody would have to draw down the full amount. We'd have variable reimbursements there, but that kind of get an idea of that. And then as well, if your board wanted to provide direction on whether this should be focused on, say, businesses of 50 individuals or less, that employ 50 individuals or less. That would be something that we'd be looking to your board for direction on. Proposal 2 here speaks to private nonprofits. Once again, we understand that in this COVID environment, it has been difficult for some people to adapt to the different restrictions. And in some cases, while we noticed there were some successes, a recent radiothon did very well as compared to last few years. We know that not everybody is having those same types of successes. So trying to establish a program, and the proposal here is for about $250,000 to be able to assist those community-type agencies, those that provide services to the citizens of Tuolumne County, to assist them for the funds that they weren't able to receive this year due to COVID. And then, of course, childcare. We have had initial discussions with some local agencies trying to see if we can get around some of the challenges with childcare to make it more universal, apply to the residents of Tuolumne County. So far, we haven't seen much success with it. Right now, we have a proposal of $250,000. But really, what we are looking for from your board here today is if you would like staff to continue to pursue this, to develop this, and find a way to make it work, as that's not established at this time. So, public health expenses. That was, if we go back to the forecast here, you can also see there was a significant chunk of the remaining allocation within that line item. And what that is there's some increased sanitation and cleaning costs. These are more across all departments in county government. It says public health expenses. This is a state category. It is their guidance that the modifications that are happening across the county all get lumped into this one item. So the proposal is to pursue different sanitation, cleaning, and protection type measures, such as touchless features in bathrooms, lobbies, all of those areas to help protect individuals as they are in our buildings and of course, staff as working here as well. Enhancements to hardware and software, we kind of spoke to that a little bit earlier, but trying to increase the capacity and capabilities of our systems to provide more virtual options so that folks will be able to stay isolated or separated or be able to do more things from home, really. And then, of course, we know there are costs with disaster service workers as well, relief individuals that are, and we start with furloughed employees, of course, that come in and help with the COVID response and mitigation measures that we're currently taking. And then, of course, the other ongoing response activities, like was stated earlier, we're going to have continuing costs when it comes to diverted personnel, contact tracing, some audit costs on the back end. There's federal audits. There's any audits that could come from OIG, the Office of Inspector General under the Department of Treasury, as well as continuing costs for PPE, ensuring employees have the capabilities to work remotely if that continues, as well as the other liability type costs there. Just a quick check-in on timelines and some important info. As was stated a little bit earlier, September 4th is a check-in report to the state. That's this Friday, in which we will have to provide the state our forecast and our plan towards expending the balance of these funds. Written into some of their guidance, it is generally expected that the county will expend most of the allocation by October 30th. And I'm going to skip here just a little bit. And the state can redistribute the funds in which, and this is their words, they believe it is abundantly clear that they will not be spent within the timeline. Of course, that timeline being December 30th of this year, unless we get otherwise notified. And then, of course, we have to certify compliance with state and local orders. That's part of the contingency of this fund, or of these funds. So, what we're looking from the board here today is direction. Are there any other options you would like staff to explore, or any options within this that you would like to discuss? Specifically, childcare is the board interested in staff continuing to pursue this, or would the board rather say see it go to the business grants and add to that pot? Any caps on business grants if the board wanted to pursue that, as well as private nonprofits. And then additionally, we ask that if the board would like to authorize the county administrator to modify and approve the spending plan specific to reacting to higher demand in some areas than other. We have 300 people apply for the business grants, and our public health expenses are less than anticipated. Or it's November 30th, and we realize we have a month to spend the funds to allow the flexibility to conduct those activities. That is the end of my presentation.
Okay. Ms. Riggs, do you have anything to add?
Yeah, I just want to add a couple of things. Thank you, Jason. He put all this together with Debbie's help. And we've been listening to the board and about how can we get some of these CARES Act funds back into the community to help those who have really been affected by the coronavirus. So their businesses, extraordinary childcare costs as they've had to deal with, schools being unexpectedly canceled last year and then distance learning this year. And then our community nonprofits that normally give so much back to our community. We have everything from interfaith to our community service groups like Seroptimus and Lions, Kiwanis and Lions, and Rotary is the other one I was thinking. And there's a whole slew of them. We could keep going. But for any of these types of grant opportunities, there is a requirement that they have to demonstrate their financial impact of COVID-19 on either their business operations. Again, we can't backfill property taxes or say a TOT tax, but we could help with rent, mortgage, utilities. I'm trying to think of the list of things. The costs that they've had to do to go outside. So if they bought chairs and tables and misters and menus, all of those things would all be eligible costs. They would need to submit those. So we're trying to figure out ways that we can get would be about approximately almost half of that funding to put back into the community. And then with childcare, we may or may not be able to make that work. We were listening to how what everyone's needs are during our last board meeting. This would be something that could be made available to everyone. It doesn't matter where they work or what type of work that they do necessarily, only that they have an impact from COVID-19 on their ability to go to work and do their normal course of their daily activities to earn an income. But again, they have to demonstrate that. So for childcare, it might be someone shows, and I'm just going to give an example. April of 2019, they paid $1,000 a month for childcare. But in April of 2020, they paid $1,500 that month for childcare. That $500 could be reimbursable, but that all has to be demonstrated. So just to kind of give a flavor for how that would look. And then as Jason outlined, Deb and I have been talking about ultimately, if your board would approve that general outline of how you would like these funds to be expended, if you could ultimately give authority to Deb and myself to work together so that we ensure we stay within the guidelines of how you want that spent, obviously working within also the guidelines of CARES Act requirements, then it gives us the ability, as Jason outlined, to move it as we get near. If we have people who submit that they have $50,000 in business-related costs, but the cap say $10,000 or $20,000, whatever amount your board wants. If we keep those, we get to December. If we haven't expended all those dollars, we can go back and do additional grant distributions to those businesses that have demonstrated that they were above whatever that cap might be. So that's kind of what we're looking at, that flexibility. But overall, are we going in the direction that the board would like? Do you want to continue expending funds? Debbie does have an update on what's actually been expended so far this fiscal year. And you saw that for last fiscal year what that dollar amount was that we spent, but also that about 300 and some odd thousand of that did offset some cost of general fund because we diverted some resources, staff and other resources to respond to COVID-19. And with that, we're happy to answer any questions or anything you might want.
You want to start, John?
Yes. We've got this money available. My position would be to try to put it back into the community as best as possible because that's what the money was designed for. So the question I have is, we've expended X number of money. If we decide that we don't want to take any more, do we have the ability to pay for the known expenses that we're going to see coming forward? Where would that money come from if we had to do that?
So you're referring to not necessarily repaying what we've already spent, but if we had obligated
We're going
money
to
already.
We're going to have to spend some money
Right.
in health and other places.
But not from CARES Act. It would go to the department. So if it were health, it'd be public health department. If it were in general fund, it'd be us. And then if there wasn't enough to meet those needs, then we would have to come back to the board for, whether it be contingencies or any other areas that the board has to pull from. We would make sure in all of this, the priority would first be to us as an organization responding to COVID-19 to ensure that the continuity of operations and services to our community continue. That would be the number one priority. We do feel as if we've built enough in here that it gives us that flexibility, meaning it could be that maybe that public health expense might not be as high as what we estimated, and we end up moving it to another category. But we did build, or the other way around. We could also pull from the bottom and move it up towards the top. So I don't know if that answers your question, John, with where you were going.
It'd have to come from someplace.
It has to come from someplace. If we don't use CARES Act, either we don't do it, or we have to pull from some other form of funding, which would be departmental and or contingencies or reserves.
Okay.
One of the things that the state wants on this very first report is to try and show that we have obligated as much money as we can. There's one little question: is it zero? Is it under 50%, or is it over 50%? So one of the things that Tracy and I are doing together is that all of the expenditures for the departments and some of the items that they're buying, and Roger's doing a great job trying to come up with some ways that we can increase our communication skills, not just internally, but externally too. Anything that we come up with that between the two of us, she always gives the final, she has the veto. This is rare, but she has the veto power. She has the veto power is once she says, okay, I've been doing POs. POs are legally obligations, and once the PO is issued, we're legally obligated to go through with it unless the vendor's kind enough to cancel it. So just yesterday, I did almost $700,000 of POs.
You gonna wait? Do you have a comment?
I only have one concern, and that goes to a perception that I hear a lot out there in the public. And that is that, well, first of all, once we obligate those monies, as Deb said, that's a legal obligation to pay it. And we either have to pay it out of this fund or this act money, or we're going to have to find it in other bank accounts, if you will, county bank accounts. This really, there's a public perception out there that this is the state's way to buy off our compliance with their COVID restrictions and all of that stuff. I don't necessarily see that, but certainly if we obligate this money and then at some point in the future, for whatever reason, we want to make a decision to go, and there are 2 cities out there that have already done it, right? To go in a direction to not necessarily defy the state, but even to the point of limiting the resources that we use to enforce the state's mandates, that the state could judge that we no longer qualify for this money, and then we might be in a position, well, I'll just put it real bluntly. This money is really a loan from the state that doesn't have to be paid back if we comply, but it does have to be paid back if we don't, at some point, if we choose not to comply. So it does put some handcuffs on us going forward. And I feel that because I get that in comments all the time, whether it's emails or texts or whatever, I feel compelled to mention that is a public perception out there, that in using this money, we're really restricting our options going forward in some ways.
Yeah,
So, yes, in a way, I would definitely say that there is a certain amount of control that the governor is using with this funding source. He absolutely is. And in those couple of cities that Sarah did some research, and we found, I think they both passed a resolution. One did for sure. And the resolution was enough to get the governor's office, as well as Cal OES, where the Mark Gillarducci, who is the director for Cal OES, contacted them directly. And so you're right, there is, but it's also, there's kind of the stick, but he's also giving you the resources to be able to do it. So when we say, can we do enforcement? Well, we do have the funds to do enforcement. What level does that mean, and how do we go about compliance, and how do we work with our businesses? It's much better, as your board has already said, try to do the carrot instead of the stick. So how can we help to reimburse for those costs associated? We know we can't make everyone whole. There's no way that we can do that. Because we talked about some counties got enough funding that they continued the Paycheck Protection Program. Well, we know for us it was like $100 million. I mean, it was a ton of money that we get $5.5 million. So that's why we're trying to find some way to put something back out into the community, but we simply don't have the type of allocation that other large counties received in order to continue something like that on for our businesses. But you're right, if we don't, I don't know exactly how that works. So if, say, the board wanted to make a different decision on November 1st, would we only be liable for not everything we didn't expend up to November 1st? I don't know, and I don't know that anyone's gone through that process to be able to tell us how that would work. Would it be everything or partial? I don't know that answer.
Yeah, and I think that area is gray enough that the answer doesn't even exist right now. This is really, would pretty much be at the whim of the state on at what level, and I'll go back to compliance, on what level of compliance would they consider to be adequate, and at what level wouldn't they? It's not, clearly if the board passes a resolution, that's pretty, that would be fairly blatant. And I'm pretty sure we would lose that funding. But I don't like being in the position of the state coming in and saying, well, if you don't do this, we're going to pull your money. I don't like that. It doesn't. There's a reason that local governments exist, and if we're nothing more than the puppet of the state, then why have us?
Yeah, just a reminder that anytime we get grant funds, they tell us what to do with it. I mean, I'm just a reminder. We get that all year long. This one, though, being tied to this event, just gives it a different.
Yeah, and there's a
overall
different
feel for
level of expectation, I think, with this one too. I think your point is taken. But we could also point to some of the other, if you're operating with a state license of any type, that state license is also being utilized as a do it or scenario. But your point is, I've had some of those same conversations, so the point is, I think, taken, and it's worth articulating it and saying it out loud. I have a question. Little different scenario because I'm aware of businesses out there that they may not have necessarily had increased expenses, but they've lost virtually all their income. I'm aware of a photography business in downtown should be closing her door because everything has been canceled for 8 months now. But she still, was paying rent and utilities, trying to stay open. Is there a way to quantify or look at, so it's not just you can show where you have increased expenses, but for those businesses that have had dramatically decreased revenue?
Sorry, we're just sitting here talking, so I'll just, yeah, go ahead.
I think if one is really careful on how one says it, then I think that there's absolutely the ability, kind of like there's programs for helping people with mortgages and helping people with rents. We could have a program that would help them with some of those expenses that they did incur. They're the same expenses, but we have to be really, really careful that we never use the word revenue replacement. So if we had a program, and again, we haven't come up with the rules, and some of the rules are to help from, and I'm making it up, help from March 1st through December 1st, and if you can show us that you lost 50% of your business, we'll pay, and again, I am making this up,
Yes.
50% of your rent, your utilities, and X. And they showed us that, then we could use this program that we're talking about to help them with their expenditures. We cannot use this program to help anybody with revenue loss.
Thank you. Okay. If there are no other board questions at this time, I will go to public comment. There is no public comment? Me too. Okay. And I guess I will bring it back and start with some conversation. I believe Supervisor Kirk, you wanted to make a comment?
I don't know. I'm just nothing. I don't want anything more but to help businesses, help the private sector, help those who need childcare. But I'm hearing what Supervisor Rutherford is saying, and I heard what Tracy said about grants and stuff, and I don't know if this is going to be used. It's being used against us right now, whether we realize it or not, because we're having to comply, and I just don't like this. And I wish I had this well ahead of time so I could dissect it more and think about it more, but it is what it is. So I don't know. I'm open for conversation and for persuasion, but I don't know if Supervisor Rutherford is against it, but I hear his concerns, and I'm concerned as well. And the longer this goes on, the more I'm getting concerned. So, not much of a question, but just I'm concerned.
Supervisor Campbell, just a minute.
Okay.
Neither of these gentlemen have spoken yet.
That doesn't matter.
Go ahead. I cede my time to Supervisor
Go ahead,
Gray.
Supervisor.
Okay. So I guess I don't quite understand the concern. It sounds like there's a concern that we would be beholden more to the state, but we have already used CARES Act funding. So if we were to go against some of the state guidelines, we would have to pay that back anyway.
Maybe.
Maybe. So I don't understand. I don't know if we're able to put money into local small businesses, purchasing PPE, maybe providing childcare. I really don't see, so much of the funding that comes from the state or federal government has strings attached, and this is no different. I think the only difference is that it's related to a, global health crisis that we haven't seen before, but the way the funding streams are coming in and the way we use them is fairly typical. I mean, correct me if I'm wrong, staff. So I don't see us being any more beholden than we already are for the funds that we use for other programs. And in that vein, I support the proposals that were put there. I think you answered one of the major questions I had about the business loan assistance program, where I would tend to prefer to give many businesses a little bit of money than a few number of businesses a lot of money, if we're able to do that. And then you address the fact that if we are able to fund businesses at a higher level because we haven't expended all those funds, and I certainly agree that we should do that. I think the PPE program has been working. Those of you who watched the last meeting and now are watching this meeting will notice that at the last meeting we had given direction for a child care program, and now that's changed. And I'm a little bit, I support any kind of child care program that we can do in our
So I
community.
want to clarify
I
that,
don't
though. We
think
didn't
we-
give direction to do childcare. I directed Tracy to go back and talk to the 5 supervisors independently, so we would not violate the Brown Act, and see if there was movement on that. So I don't think we said we are going to do childcare for employees.
That is correct.
Thank you.
So we came away with a consensus that that was a priority that we should pursue, and it's no longer being pursued.
No.
No, I don't think that's it either.
And so what's being presented now, while I certainly agree with the sentiment of wanting to help as many people as possible, having had experience with programs that that place a great deal of onus on the person seeking the funds, these things take a lot of time to construct and are very difficult and take a lot of staff time. And frankly, I've seen more than one similar situation be unsuccessful. So I'm a little concerned that this, what's being proposed here, doesn't have nearly the support or guidance that the original plan had, and that we won't be able to fulfill the goal of helping as many parents and children in the community as we would like. I think we probably would have helped more if we had stuck with the original idea. That's my opinion, obviously. But I would certainly hope that that you get a lot of support in fleshing that out. It's going to take a lot of work, but any way that the board can help you to make some kind of child care assistance, some kind of reimbursement program work, I hope you will be willing to ask for that.
John.
Okay. So getting back to the CARES Act. The purpose of the CARES Act wasn't something that Tuolumne County created. It was a federal program that says we're going to infuse money into cities, counties, states to try to help overcome the hurdles and problems that were created by COVID. Is that pretty much the basic? So with that, we are looking at some opportunities on how we can do that. And I agree with Supervisor Rotifer. There is some risk there, and I'm willing to take a little bit of a risk in order to put that money in places that it was designed to go. We need to help some of those businesses out there. We really do, and if we can do that, then more power to it. That's what the money's for. And I never want to lose sight that that's taxpayers' dollars, no matter how we cut it. It's it's money that we don't have in the federal government that we're spending, but it's not coming out of Tuolumne County's bank. It's coming out of a much bigger bank. So I would think that we should try to do as many of those things that are reasonable and help as many people and businesses that we can, because that's what I hear from everybody, that the businesses are the ones that are hurting. There's people out there that are not going to be able to go to work because they're going to have to stay home and take care of their kids, whether they're county employees or not. So I think child care on an overall scheme is a reasonable thing to look at. And these community agencies, the nonprofits, they do a lot of good. If I was looking at a report, and I can't even remember where I read it, it could have been Union Democrat, but how much less money these nonprofits have available to them right now, the Meals on Wheels, and I think ATCA was listed. And there was a number of kind of private nonprofits that do a lot of good that the money's not there. And so that means less people in need are going to be helped. So, looking at what we have up there, to me, it looks reasonable ideas to try to approach. The money is only going to be there one time, no matter how we look at it. Maybe there's going to be another CARES Act funding. Who knows? But I'm not going to bet on it right now. I already lost one bet. I thought it'd be done by August, but it's not. So anyway, that's my 2 cents.
Carl.
Yeah, I don't want people to misunderstand my initial comments. That's just a concern I have with this. If we have the ability to help out our local businesses and our citizens out there to weather this storm, whether I agree with the ship that we get to sail of this storm in or not, I think that we need to do what we can to provide that support for our businesses and our community at large. So we'd look pretty foolish if we left money on the table and it got spent by somebody else out there. I'm okay with the presentation, but I have to tell you that I don't like the way this was implemented. I think that should have come from the feds directly to the local jurisdictions, and we should have been allowed to manage it within the guidelines that the feds had without state intervention. And it bothers me any time that I do go down a path of taking an action, or we go down a path of taking an action that potentially puts handcuffs on our ability to make what we think is the right decisions for our people and our businesses. But we've got the money. We should use it as best we can to take care of our businesses and our people, and I'll shut up now.
All right. So what I think I'm hearing is that we are good, as this was basically outlined with using those 3 pieces, with number 1, looking at how we can organize this, if you will, to look at both sides of equations, expense. I'll leave it there. And bullet number 2, I think, is pretty self-explanatory. Bullet number 3 on the child care, with the caveat that is open, if it can be done, open to everyone, because I think that's the only way I can see that piece moving forward.
One of the things I don't know, maybe Jason did mention this, that we have reached out to one for sure. I don't know if we did both. Just the one. So we did reach out to ISIS about maybe administrating this for us. They weren't sure how to make it work because it doesn't necessarily fit into what they already do. We'll continue those conversations. Otherwise, I will need to sit down with Deb and say, how could we make this work? Now, we do have the CARES Act available to pull in, help to, for looking at some of this stuff. So we've already been talking about where and who and how. But it's still a work in progress, and we're going to do our best to get this rolled out as quickly as we can. The other thing is we would be moving the business grant or reimbursement program would be moved from the Education and Compliance Committee to work between Deb and myself and our staff and whoever else we might pull in to help with that. So it would be separate from that, the Education and Compliance.
And that makes sense. And then I assume that we are also, you asked for the ability to, as this rolls out and you see one pot not being utilized and another with a lot of requests, to give you some flexibility in moving between these a little bit. Looking across the dais here for agreement on that, knowing that you will be coming back and reporting out.
Absolutely.
On a very regular basis how this is rolled out.
I do just have one more concern to voice, and I have to do this because I've got a particular constituent that had a what they consider to be an unsatisfactory experience. We need to be able to assure the state, obviously, that we are doing what we can to gain compliance in our communities, and I understand that. But when an application is denied solely for noncompliance without an opportunity to come into compliance, I think that we need to think about how we're doing that.
Oh, I agree.
Okay, and that did happen in one situation in my district. So I'm all for making sure that we can assure compliance, but just an outright flat denial on a one-time non-compliant inspection without an opportunity to correct is not what I would like to see.
And actually, the way that it was formed, and I'll follow up with you offline here.
Sure.
Was that it was for those who are in compliance or working to come into compliance. That was actually in all of the information that we had posted and made available. So we'll find out who that was and get more details. Yeah, great. Thank you.
All right. Is there any other conversation on this item?
No, just since I was the one leaning in Carl's directions after hearing the conversation, big picture, of course, anything we can do to help locals, we got to do. Like Supervisor Rhoda first stated, there's strings attached, and I can't predict the future, and I don't know what's going to happen in the future. But we know now that people need help, businesses need help, childcare is needed for our constituents. So, with that, I would agree.
All right. You have enough direction? Okay.
Thank you, Jason.
Thank you.
Thank you. Okay. Our next 10 a.m. appointment will take some time. I'm looking across the dais to see if everyone is doing okay or if you need a small break. 5 minutes. 5 minutes? We will take a 5-minute break and then go to our next appointment.
Thank you for asking.
Mm-hmm.
Is to create a healthy and safe community, exercise natural, cultural, and financial resource stewardship, and promote economic prosperity and enhance the quality of life. Part of that is ratified in the California Constitution also, where it says public safety is the first responsibility of local government, and local officials have an obligation to give priority to the provisions of adequate public safety and services. So as we go through this, we're going to start with some history on how we got to where we are today. So, and just as a reminder, the State Budget Act requires local elected legislative bodies to pass a recommended budget on or before July 1st and adopt the budget no later than October 2nd. The fiscal year 2021 adopted budget public hearing is currently set for September 22nd.
Okay, we wanted to, as we go through this, as Eric said, we're going to do a bit of a review. So we'll go back and do a bit of a fiscal year 1920 reconciliation where we talk about fund balance. And then we will do a review of how do we balance a recommended budget. And then we'll move into recommendations and board direction for the 2021 adopted budget. So as your board is aware, every year department heads and Debbie's office and my office begin working with departments on fund balance. And this is always a tricky process because we start doing this in sometimes February or March, and we're talking about what do we think they will expend through June 30th. And often what happens is we don't go in and strip those budgets because we don't know what might happen those last 3 months of the year. And then other things happen that are good news where we get additional revenues that we had not expected, whether those are within the department or whether those are general revenues like PILT, which was $190,000 more for fiscal 1920 than what we had expected, which is a good news item. So what you have before you on the screen is the actual year-end fund balance was $3.2 million. We had estimated almost $1 million at $945,000, and that was an increase of almost $2.3 million than what we had projected. Then I went back, and these are, and Deb's here for any questions, because this is the accounting part of fund balance. It's what really happens, not what the spending plan is. But when I went through and looked at Deb's worksheets that she provided to me, almost $1.6 million of that variance came from departments. That means they had either one or a combination of decreased expenses and increased revenues of $1.6 million. And then we had good news. Not only did we have the $190,000, but we had a total of $734,000 in increased general revenues, which gets us to our $2.3 million increase. And then you'll see on the bottom where it says the CARES Act, where we have some general fund expenses were absorbed by CARES Act funding. And that's because we, again, have redirected some of our resources, staff and other resources, to respond to COVID-19, which allowed us to use that funding that we were just talking about a few minutes ago, the CARES Act. And that was a little over $300,000 for fiscal year 1920. That is part of that fund balance that you see. So that would have been part of that departmental change of that $1.6 million being better. $300,000 of that is related to the CARES Act.
Okay, so time for the recap of the 2021 recommended budget. As you recall, there was a savings that we had to come up with to make it balance. That was done between temporary and permanent savings. Some of the temporary savings were concession bargaining, and we'll get into a little detail on each of these here in a minute. Temporary closure of recreation, standard park, youth centers, library, as well as unfunded and frozen positions. And the permanent reductions that we did were in the way of layoffs. So some of those temporary cost savings equated to about $1.5 million. Throughout all bargaining groups, including elected officials, there were concessions on salaries, ranging from just straight reductions to furloughs included. Other groups also had language in their MOUs for furloughs as well, and that was applied to those groups as well. So that's where we came up with the temporary savings of about $1.5 million. In addition to that, we had a total of 25 positions throughout all funds that were unfunded or frozen, which made up about another $1.8 million. Again, those costs will come back in the next fiscal year in 21-22. So again, these are temporary. So we expect all that to come back in July. Again, standard park, youth centers, and recreation made up about $400,000 worth of temporary savings. The costs to run those programs are higher, but they are offset somewhat by revenue that's generated through recreation and standard park. So overall, for the temporary cost savings, we had almost $4.1 million. Moving on to library and recreation, a reorganization of those two departments was proposed at the recommended budget, which saves about $354,000. At that time, your board did not approve the reorganization and just direct us to come back for further discussion this month. Some of the permanent cost savings was through temporary and permanent reductions in spending. In addition to that was the permanent cost savings of layoffs. In the general fund, we had a net decrease of 6. 4 of those are from the library, 4.5 of those is from the library alone. And then the other departments there as well, you can see overall the net decrease was 8.5 FTEs for a permanent cost savings of about $700,000. But again, that included the library staff that your board did not take action on at that time. So personnel actions in the recommended budget was a 8.5 FTE reduction. 25 positions were frozen and 6 were furloughed for almost 40 positions in the recommended budget. Again, these positions were affected in the 2020 recommended budget, but will come back next year. and will obviously have an effect on the services. So that's where we ended the 2021 recommended budget, and now we'll get into the 2021 adopted budget and where we're at.
Okay. So we had talked about the beginning fund balance was approximately $2.3 million more than what we had estimated. Of that, about $140,000 of that fund balance were due to some projects in IT that did not get completed, and I have taken the liberty of rebudgeting those items to ensure that we get that work done. So we also have $1 million in contingencies in the adopted model, and we have $250,000 going to reserves. What that gives at that point of the beginning fund balance that would be left over is about $898,000. The total available fund balance right now, so when we look at our beginning fund balance, current year revenues, and then look at our expenses and what comes out, you have almost $1.3 million left over that we'll be asking your board for direction, in addition to some of the other changes that we've made in the budget that I'll need your board's authority and approval if you're good with those as well. So on that same slide, when we talked about in our office and is restoration of concessions. And so we had spoke to your board previously about the wage freeze, and your board had given authority to go ahead and move forward with the bargaining units to begin that conversation. I also had recommended the furlough, and I'm looking going from 3 weeks to 2 weeks, and I'm looking to your board to provide direction on whether or not that's something you would approve. I'll stop at different parts throughout the presentation so we can have a conversation about those specific parts at that time.
Okay.
It's my understanding that if we change that furlough, that's going to really complicate some bookkeeping and other things. So I'm thinking that, although I hate to disagree with you, I'm not too sure if that's a very good recommendation.
I'm going to tend to agree, especially given the nature, I think the nature of this very unsettled budget situation with COVID and with the previous discussion item that we had on CARES funding and all of that stuff. I just don't think that we can, I don't think it would be a wise move. Although I don't question your wisdom, CAO Riggs, I just don't think it'd be a wiser move. I like the restoration of the wage freeze or unfreezing of the wage freeze, but I think furloughs is just too big a hurdle to leap at this time.
Supervisor?
Yeah, I agree.
Okay.
Yeah, just the wage freeze and the step increase, correct? Those two? Yeah, I agree. I understand some of these units were in contract, and I appreciate everybody coming out and working. But I know these things take time, and I'm cognizant of Debbie and staff and the undoing of all this. So while I think it's fair that we give something back, I'm fine with holding that line with those two aspects and holding the furloughs.
All right. You have consensus in direction on that?
Okay, and I realize I probably should have shown you the next slide, which is the one that's up right now, which might have helped you also make a decision on some of what we just discussed as well as we move forward. So
some of us read ahead.
Yeah. So your board has been hearing Debbie and I talking about the importance of balancing current year revenues with current year expenses. And so I call like this kind of a health checkup of the budget as it's comprised right now. So right now we have $74.7 million in current year revenues, and we have $75.4 million in expenses. That $75 million, I did pull out the $1.25 million going to contingencies and to reserves. So it's more of a pure number, so to speak, so it doesn't include those two items. But as you can see, we're still using $712,000 of beginning fund balance to balance our current year operations. And that always will put us in a precarious position, and we should always do that with extreme caution as we move through the year.
Let me clarify maybe for the public what that really means. And when you do this, you're kicking the can on that amount of money into next year's budget process. In other words, we're building in a $712,000 problem next year. So it really is important to the extent that you can, and you can't always do it, obviously. But it's really important that you try as close as you can to balance those two out.
Yes.
Am I misstating anything?
No, I think you're absolutely right. And one of the things one of my coworkers had brought up was not everyone understands what fund balance is. And I thought that was a valid point as someone who's listening in. So when we begin our budget year, we have, just like we showed here, so much in revenue and so much in expenses, and we balance that out to have what we call a zero budget, meaning at the end they both balance. And the hope is that we will always have more left over than what we started with, and we've always done that since I've been here, and that's a good thing. But what that means is that we're always building in a certain amount of reliance when we use fund balance for the next year's operating costs. When we use it for capital to pay down debt, and I'm going to go into our not our debt policies. We do have those, but to our budget policies, which are what help guide all of us in where would the board have us do and take certain actions outside of coming to you directly for every single thing. But it speaks to our use of fund balance in our budget policies, and we're going to go through those next. Okay, so this will take just a few minutes, but I do think it's important, especially for those who aren't necessarily as familiar with these or understand that we do have board-approved budget policies. So the first one is balance annual operating budget without the use of one-time revenues. We know we're not doing that right now. We're using $712,000 of beginning fund balance that is considered one-time revenues in terms of the fiscal year 2021 budget. I'm giving too many budget years ahead as we talk about this. And then the second one is dedicate unobligated beginning fund balances to establish annual contingencies. We've done that. Pay off county debts. This year we don't have any. All of our debts right now are really, really big. Increase reserves, we're doing that. Fund future liabilities. This budget does help to fund future liabilities. And then fund capital equipment, plant, and infrastructure. There is some built in for that last item for E, and then we will ask further board direction with that remaining dollars, other items you might want to do. So general fund contingency should be budgeted at no less than 1% of the general fund operating budget. And we now, general fund, you just saw our budget is, the operating budget's $75 million. And right now we have $1 million in general fund contingencies. So you're about $250,000 higher than what you would need according to this policy. Establish reserves at 5% of the total operating budget for governmental funds and strive to set aside $250,000 each year towards meeting that reserve. We have the $250,000 going to the reserves in this budget. However, we are far from 5% of our governmental funds. We're at like close to 2.7, Deb? We're at 2. They'll be at 2.7 if this 250 goes in. So you can see total governmental funds, I'm thinking, are 160 million, I think. Yeah. So at 2.7 million, we're a far cry from where we need to be. That's why it's so important that we continue putting a minimum of the $250,000 into reserves every single year. The next one is we talk about future liabilities and internal service funds. Workers' compensation is an internal service fund, and the goal there is that we would charge departments a little more than what the actual projected amount that we would need is, so that we can continue building that fund balance to get to the 70% confidence level. The liability insurance, the goal is very similar. We charge sometimes a little bit more than what we think we will need, so we maintain a cash balance of $250,000 in that fund. Unemployment insurance, the goal is to keep $100,000 in that fund. However, this year we had to completely revamp the way that we're handling unemployment due to COVID-19. Post-retirement medical insurance, this is something that has been eliminated. So as of 2000... Well, all right. So we have certain employees who get post-retirement medical for the rest of their lives after they retired. So 2007, that was terminated. There's another part that Debbie was speaking to. Because we're because we're PERS, right? However, with that, we do charge a little bit more every single year to continue to fund what we think we will need for future liabilities in that fund, and we are doing that this year as well. Leave liability, it's the same idea. We look at annual departmental charges. We try to set a little bit higher than what it is that the auditor controller tells us she thinks that we will need, so we can continue building that fund. And then the PERS, PERS is a beast in itself, but we the goal is to set annual departmental charges to be higher than what the annual rate is for PERS, and that difference would be used to pay down our PERS liability. And Debbie does something every year where she prepays it, and that saves us hundreds of thousands of dollars every fiscal year when she does that. We're almost done. So number 6 is prioritize funding for public safety and road maintenance services, and I think that this budget does do that. Strive to provide funding to adequately maintain existing plant infrastructure. We did increase the amount for deferred maintenance and some capital that's already been built into the budget, and then again, we'll be looking to your board for some additional direction. Maintain a comprehensive quarterly budget monitoring and reporting system. We work that. Your board knows, we bring it to your board. Continue an active long-term capital improvement program, which includes a section describing financing methods. You may remember last budget we'd come to your board stating that we need to redo our CIP. At that time, the board had other priorities you wanted to use because that is an expensive process. But we will be bringing an update on the last CIP so you can see what's been completed, what still remains, and then we can talk for future needs for a future assessment. And then number 10 is really about just match specific state and federal funding reductions with commensurate cuts in specific costs. What that means is when something is grant funded, when it's no longer funded, it should go away. Are there any questions on any of those policies? No? Okay. So as I was saying, there are certain liberties that I have taken in working with your departments to go ahead and put some items into the budget. So this is a list of what's different in the recommended budget. From the recommended budget, I'm sorry. So some of these are based on board action that or direction you've already given us, and then others are on conversations that I've had with you and department heads maybe in their evaluations. So the first one is in our community development department. I have to say this department, I think you guys know this, they continue to kick butt out there. They are so busy. And if it's not one form in large development projects, it's in remodels and new construction. We continue to, when I say we, I always say we for everyone, they continue to exceed their projections every single year when it comes to their revenues. We are asking that your board, we put this in here, and of course all of these things can be changed. Your board just has to provide direction. But right now, the budget scenario in front of you includes a planning manager. Also includes the Track It software, which again helps her with tracking each of those projects. And then the climate action plan, which she's required to have completed. We need a little more additional money to get for that consultant. Any questions on that one? Otherwise, I'm just going to keep going through.
I have a comment on it specifically. Well, first of all, the planning manager, I'm all for. We've got a department head that's splitting her time between trying to be a department head and at the same time being a sub-department manager as well. But that Track It software is to fix an endemic problem in that department that we get complaints on all the time. This is going to so much improve their ability to do their job, and I think it's essential that we get that. So I'm all on board with that.
I was just going to mention that $65,000, that's for 6 months. That's not right?
Correct. That's partial year, yes. Okay.
Don't see any other questions.
Okay. All right, so I'll move through some of these, and then by each slide I'll stop. So human resources, your board had recently also approved a safety analyst. This is partially offset here. For the first few months, they will begin working on all the COVID type policies that we need to have in place and get those updated. And then they will start working on other projects that we know we need to get done, other training that needs to happen. And the plan is for the current year is we would use the fund balance of the internal service funds to fund the offsetting amount. So that would not be in the general fund cost. Future years, there would be a general fund cost. However, we'll work with Debbie. It's going to more come through the A87, which is how the administration works and is allocated to non-general fund departments, and probably more detail than you wanted to know. With facilities, we increased the deferred maintenance line. We know we have a huge backlog of deferred maintenance amongst all of our buildings. We had been decreasing it over these last few years. This year, I did increase it by $150,000, and also remembering that we did, your board did approve an additional building facility maintenance worker. And so we've added in a vehicle for that individual as well. So they'll have more manpower, they'll have the vehicle to do it, and we expect to see great things out of them this next year.
I have a comment on that too. Deferred maintenance is one of those things that as you defer it, the problem gets dramatically bigger over time. We've got to eat into our deferred maintenance. This is an absolute must.
Yeah, for sure. And that's one of the reasons I took the liberty of adding that in. So in county council, we did add some additional money in her budget for outside counsel. Animal control, your board had discussed about the need. We knew that we had stripped all of their part-time salaries. This is putting some of those part-time salaries back into their budget. Mock fire, I honestly don't know what that number will be right now. We threw out we put in there $100,000. We'll have a more refined number, but right now in the budget, we're talking about $100,000 for mock fire response. And I don't know if we will, I don't know if we're going to see, if we'll get any other additional reimbursement from that. Sorry, we have. Okay. So we'll have a more refined number when we get to the September 22nd budget hearing. And let's see, where was it? Oh, IT, we already talked to you about rebudgeting the software, hardware that they did not get to in 1920. So all of those items have been included in the budget. The other thing that we took, sorry, Sherry, did you have a question?
On the mock fire response, do we know yet what level declaration? Have we heard back on?
We have not heard back, and we don't know. At this point, we've not received anything from the governor saying that we're getting CDAA or federal. It's a very low amount, so I'm not sure if we will get anything.
Right.
Doesn't mean we won't ask and continue to ask, though.
Correct.
Yeah, for sure. Okay, so the next slide is recreation. So also in this budget, we have added back in recreation, and it's from March through June, which hopefully we can get them going in the spring is our big hope here. What I also wanted to do, though, at this time was Liz has been working with Eric Aiken. We had talked a while back last year, like March, April, seems like last year, about fees for recreation and some different ways that those fees can be applied. And so she has some ideas with that. I want to just have your board kind of give some general direction. We can bring these things back, but it does help us build the budget for a better idea of what the net county cost could be for running these programs. And I think he also worked on the hall rental policies too, Liz. Is that in there? Okay.
Well, yes.
They're going to pull that up for you.
So it's not quite as refined as Tracy and Eric's beautiful board presentations, but this does give you an idea. So I know you've likely seen or remember seeing these fees in the past. So you can see the second column there are the current fees, what we charge. So summer recreation, $120. Tiny Tots, $124.75. And then you can see the full cost recovery. I know Eric has gone through those before with you all. So he is proposing, he really spent some time looking at what would be a balance between full cost recovery and what he believes individuals who use the programs would pay. Of course, there's the balance between if you charge it too much, then people aren't going to use the service anymore, and then our revenue, of course, is then zero. So trying to strike a balance there. So we would be looking at, so that's his proposed fee there in column F. Then another idea that we've been discussing is a program for people who receive any type of public assistance. So if they receive the free or reduced meal or lunches program at schools, or if they receive Medi-Cal or any other kind of public assistance program, they would show proof of that. And then they could use, or they would be charged the fee that we currently charge, which is here in column D. And then everybody else would be charged the proposed fee. So if you would like to go with the fees as recommended, I should say too, so the hall rentals, the policy isn't quite done, but Eric's recommendation is that we would charge all people across the board for 20. So any of our halls that have kitchens, they would cost $20 to rent, $20 an hour. And any halls that do not have kitchens would be $15 an hour. And those are that's basically our cost recovery for that. And yes, so let's see here. So I think that's kind of all I have here. If your board doesn't want to do the public assistance program piece and just wants to charge, a flat rate, then we're looking at almost $300,000 in revenue. If you want to do the public assistance piece, of course, it's very hard to estimate how much revenue we could potentially pull in. But looking at some of our other figures that we have, about 20% of our population is on Medi-Cal. So kind of using that as a rough maybe guess, we were thinking maybe 30% of users would be on public assistance. And so we would be pulling in almost $260,000 in revenue. Of course, this is all estimate. Recreation, it's not exactly about revenue generation, but so that's what's being proposed today.
So my comment is, if we're going to do this fee structure, and I like it, but I do believe that we need to have the public assistance piece of it. This is not across the board a real wealthy county, as I think most of us know, and we have probably a higher than the norm across the state percentage of people that are on public assistance, and more than anyone, especially for child programs, they need those recreation programs to help raise their kids and all that stuff. So I'm in favor of that.
And I agree with Supervisor Rotifer. The worst thing you can do with a pool or a park or some kind of public recreation area is to not use it. And so I tend to side with anything that will help increase our usership. And to me, that, $296 versus $258, it's not, I don't want to say it's not a significant impact, but what you're getting for that impact is a significant increase in the potential people who could use these resources and help keep them viable. So, yeah, I do support the column H with the public assistance plan.
And I want to mention, too, that he's proposing that our summer recreation program, our Tiny Tots, our spring break day camp, and swimming lessons would be the programs that would fall under this public assistance program. So lifeguard training or just general renting of the pool would not,
And Liz, just look at, so if free and reduced lunches is one of those pieces, the school should be able to give you
Exactly
what
right.
percentage of folks are on that. And so it might give you a little bit better idea for refining those numbers, because I think you would see a lot of crossover with the programs that you just spoke about and that trigger mechanism, if you will. So it could be higher than 30%.
Sure.
So.
Yeah, that's true.
Quick question. I may already know the answer, but like when at the Memorial Hall, for instance, there's a group that feeds the homeless and people who are kind of down and out. Well, I think once every 3 weeks, and obviously they're going to be charged $20 an hour if they're there for 3 or 4 hours. $80, $100, whatever it is. What's the difference between those groups who provide that type of nonprofit service versus the group that we're just discussing, possibly providing CARES Act funding for those nonprofits? I guess, is it based under the umbrella of their nonprofit and these are just local volunteer groups? Because I know people are going to say, hey, why are we giving nonprofits CARES Act funding and yet we're being charged to provide, we're providing these services?
Right, well, remember that a true nonprofit is recognized by an Internal Revenue Service, so that's part of that. There's a formal recognition. And I'm not sure that the two can really go together. One of them is there's a cost. We have to have people go down. They have to open it. They have to clean it, all of those things. So this is a minor fee. Like if you were to go rent any other type of formal hall, we all know who have done that. It's usually hundreds, if not thousands of dollars. So we were just trying to get it and it can't be more than reimbursing costs. This still isn't full cost, but it's just a portion to offset what it is to allow those to utilize these buildings. That's really what it does.
And I have to say, I've had, thankfully, only a single instance, but I've had a single instance in my district where not having at least some skin in the game, the organization, I'll just say, abused the privilege. And I'm not going to go into details because I don't, that's not my purpose. But I think that having some skin in the game, besides the fact that we recoup the cost to the county a little bit, or some of the cost to the county of opening it up, running the utilities and that kind of stuff, I think that's not unreasonable, and it gives them some skin in the game and something that we can actually control their behavior with.
So we also have our standard park fees as well for your board's consideration. You can see right now we look at the renting of the field as in total. Right now we charge $7.75 for youth. The full cost recovery is almost $100, and so we're proposing $15 per hour per field. And then for adults, it's $18 per hour, and when we're proposing $25 per hour per field. And full cost recovery for that also is $100 or just about. And then for the adult softball league, we're almost right at full cost recovery. So right now we charge $45.25. Full cost recovery is $50, and so we're proposing $50. And then, of course, our youth centers, we don't charge for those, and we're proposing to continue not to charge for those just because of, who uses those facilities.
I'd like to stand up for one of my groups. They were here last time when we talked about it. Perhaps there should be some kind of waiver for some groups. There is a group that volunteers at our museum and puts in hundreds of hours. They volunteer at the archives and they put in hundreds of hours. They volunteer downstairs in elections and they put in hundreds of hours. And their group, the Genealogy Society, meets over at the library once a month. Maybe there's some way that there's a waiver where Pat Perry came in and spoke to you guys, so I'm Pat Perry for the second. That maybe there's something where they can show the demonstration where they get credit for the 3 hours a month versus the hundreds of hours they put in every month. She was a lot more pointed than I'm going to be.
And I think that's a very important thing to consider. I think I heard John say in-kind contributions, and that might be something to look at, whether we can, as long as it's very clearly defined, where we have a set list, say, of activities within the county that qualify as in-kind contributions. So it's not just, everybody says, I picked up a piece of trash on the side of the road 2 weeks ago, where we have it very clearly outlined what qualifies as an in-kind contribution. I don't know, I'd be open to that, but I'm willing to hear from others.
So what I would recommend is, like our Genealogy Historical Society, or even Friends of the Library, both of these actually contribute to the bottom line of county-owned assets, programs, or departments. And so, for example, what could happen is we told the Friends of the Library, if we went down this road, is the library would actually be the ones making that reservation because they do contribute to the library system across the entire county, as does the group that Debbie's referring to. So when it's actually someone who's actually providing a service, it could be, for example, county staff, maybe it's Debbie or Kanan because of the museum, who actually make that reservation on their behalf rather than them doing it on their own. So it's not, we're coming in to have some abnormal type of meeting. They really are someone who is part of the county system, really, when you look at it that way. They're a little bit different than some of the others who utilize it only for the building and aren't actually providing a service in any of our departments. That would be a recommendation I would make. That's how we are working with Friends of the Library, and I think we could do the same for our Historical Genealogy Society. They do give back so much, and they are part of the organization.
Yeah, and there may be some others. I like that if it's made through staff that is connected. You got Friends of Animal Control and different organizations that you're right, they really do contribute to our success in keeping programs healthy. But if we run it through that department head, if you will, then there is some checks and balances in place.
So
I'm
it's a
looking
yes
for
with those.
consensus across that concept. Okay.
And with the fees, we just are looking for general direction. Yes, move forward. We could build those into the budget. We will. Most of these won't even take effect until we really are able to open all of them. So it gives us some time to truly put those new policies and fees and get some notification out to those stakeholders. As you can see, we've tried to do the best that we can to recognize that not everyone is equal in terms of financial ability to participate in some of these programs, which is what the staff has tried to do here.
So the only one I want to go back to for clarification, again, just because I think it's really important, youth sports in particular out at Standard, what kind of increase were they going to see, or was that predominantly, again, we want kids to be participating in these kinds of activities, and we hear it all the time. And so can you just go back over that piece again?
Sure.
While they're pulling that up, just as a reminder that the fee that she's going to show you, where we go, say, from 8 to 15 or whatever it is, that even if it's a per field, remember you might have 10 kids using that field at a time. So it would be that increase would be split up amongst those 10 families. And I do recognize that sometimes there might be, 6 families, for example, because of the multiple children and all participating in. But just as a general, just as something to keep in mind when we look at this.
Yeah, so right now the current fee, say, to rent a field at Standard Park is $7.75 per hour. We would be proposing to raise that to $15 per hour. But again, the full cost recovery is $96.75. So, but as Tracy mentioned, it's not like each individual child is going to be charged $15 per hour, say, because it's usually a team that's renting a field. So.
Thank you.
Okay, so general consensus or direction is go ahead and build those new fees into the adopted budget. Okay, great. Thank you. Thank you, Liz. So the next thing that we wanted, oh wait, I didn't finish this one, sorry. So we show this, and this will vary a bit, the impact to the general fund, where we talk about $275 for recreation, Standard Parks 136, Youth Center 78.6. That may change a bit as we work with these new fee structures, and we'll give you an update when we come on the 22nd. I had made a previous recommendation for the wage freeze. Your board had approved that part. That's been built into the budget already, so that was approximately $225,000. Fire needed an additional $50,000 to balance. You may remember, again, this is a lot about our fund balance. We had thought we would have a higher fund balance than we did, so I did put in that additional $50,000 to balance out the fire fund. And then with realignment, remembering in general revenues, we get some money that comes in, but it goes right back out because it is dedicated funding for our health and human service agencies. Okay, so the next one, I want to talk about library because this will be important in how we create this budget and also affects the staff that we have. So during the recommended budget, we had come to the board and we had made a recommendation that you have a library recreation manager. He and I had worked together that we felt we could reorganize the two departments and they would help work with each other, meaning that in off-season for recreation, the recreation staff would be able to work in the library systems and that would reduce the cost to provide those services. During that time, that this reorganization that I speak to would have required the elimination and elimination of 4 employees, but also change the types of classifications within that library system as well. So what we're looking to your board today is do you want to proceed with the reorganization? And then we would also, your board asked us to come back with the Twain-Hart branch and the bookmobile. We as staff still feel that what we recommended is still the best fiscal model. However, obviously we defer to your board for whatever you would like us to do on the next, however you want this budget built and the services that you want provided. On the next slide are the personnel, so you can see that we normally in fiscal year 1920, there were 9.5 FTEs, and you can see the types of classifications. And the new proposed model, there would have been 5.5 employees for a net decrease of 4, remembering that the recreation staff would have backfilled on their non-season hours or months. The months that they had programs going, that's when we would have utilized our relief staff. So when we had them there, we wouldn't have needed relief. When they weren't there, we would have pulled the relief staff in. In the event that your board would like to go back to the status quo model that we had in 1920, that cost is approximately $230,000. Our goal, we do know that we can get libraries open according to similar rules that retail. It's almost exactly the same. Eric is going to be working or is already working on a plan to submit to public health so we can get those open. But what we could do is we're trying to get those open as quickly as we can. So once we get to the board, we go to the board on September 22nd. I believe the next pay period starts on September 27th. So we would have the employees all come back in on September 28th and begin working to get those libraries back open. But what we need direction from your board today is how do you want that model to look? Do you want it at the recommended? Do you want to go back to the 1920 status quo model that we had before the COVID-19 came?
Yeah. So I put a lot of thought into this, obviously, and I understand the recommendation based on some of the fiscal elements that you outlined there. We've sort of been backed into the position that we are with respect to the libraries, partly because of COVID-19 and partly because of predicted shortfalls in our budget. I favor going back to the 1920 model, restoring some of those positions and opening the Twain-Hart Library and the bookmobile. And there may be a point where we need to look at those things and potentially close branches or eliminate some of the services that the library has. But as it is, I don't like that we've been backed into this by forces outside of our decision-making. So I think if we are able to talk to the community and look at other partners out there and find what is really desired of our library and what is feasible, I prefer that model, and this will allow us the time and the ability to do that. I just don't, the urgency isn't what it was 6 months ago. And I understand we would have to come up with some kind of solution long-term, but I'd like to have the time to do that. So that's kind of where I stand.
Could you define that extra cost one more time? how much more money we're looking at to go
Yeah,
back to
it's
that?
on your screen there. It'd be $230,000, and that would come from that almost $3 million that we have remaining left that we're asking your board to direct on how you'd like that spent. That would bring us up to about $900,000, $950,000 or $40,000 in use of fund balance. But there are other things when we talk about that we've increased that aren't necessarily operating, like an increase for deferred maintenance. So, but it would increase that use of fund balance.
Yeah, and I would also point out that there were some other pieces that we suspended because of COVID with regards to recreation, specifically, say, our pools. And, I think that those opportunities, next summer, I know we had conversations about pools that the county owned versus pools that we rented. And so I actually, while I'm understand, I think this plan has tried to accommodate for all of the different areas of the county. And I think that there are going to be other pieces that this board will be looking at with regards to some of those recreation components. Again, I'm going to specifically say pools that could be factors next summer. And just, I really think that in a water county, we've got to find a way to be providing opportunity with regards to swim lessons and
just to be clear,
summer pool recreation.
We would not be pulling them from those seasonal activities. That's when you would have use of your relief staff in the library, just to make sure so you.
Correct,
Yeah.
but thinking about some other potential maintenance pieces that could come along with a swim program.
You're asking us to give you some guidance in a lot of singular areas, and I'm not sure that I know what the total impact is. I mean, I want to do them all, okay, but we probably don't have enough fund balance to balance the budget and do all of them. So is there somewhere in this that we're going to look at the balancing act?
Yeah, so the reason I hit on this one first and separately is because this has been a point of priority for the entire board from the very beginning. So we will get to that. That's coming up, yes.
Okay,
But this one I hit on first just so that, we obviously need that direction. We also will need those employees are furloughed at this time. But yeah, we could circle back and you could say, yes, these are the items that we want to add back.
For instance, libraries are a priority for me, just like they are for everybody else. But we've got two options to operate, at least two options to operate libraries, two different models. And I know what the difference in the cost between those two models is, but what I don't know is, if I make a selection of one over the other now, how is that narrowing my decision-making capability down the road?
Right. Yeah. Okay. Well, let's
keep going.
Continue, and then we can come back to that. So this is just to give you contingencies by fund, just so you have an idea. We'll have this updated for you when we come to the adopted. But when we ran the reports, and I did this presentation, we had $7 million in different departmental contingencies and different funds. So here we get to, remembering you had $1.27 million to spend that was remaining. So I want to go through some of these items with you, and these are us working with departments and also looking at some of deferred maintenance and capital needs that we have out there. So and I did update this a little bit while we were at lunch. So while we were at lunch, we were talking about OES coordinator and the fact that OES is done when unless there's an emergency, as we have time, because we've always tagged it on to someone. We received an additional $70,000 from OES for our EMPG grant. EMPG is what we utilize to help support the OES coordinator. Right now, OES coordination, according to that grant, is split between Liz and Jason. And so as they have time to do it when there's an emergency, but it also impacts their capacity to assist the board and departments. So when we talked about that, the expenditure period has also been lengthened out for that. We also have some admin that we've pulled off from other OES grants. So part of this is the request that the first year, probably the first 18 months to 24 months, there would not be an impact to the general fund for this position. However, in 21, 22, 22, 23, there would be an impact if this position were added in. And that impact would be, we would no longer use the EMPG grant that we get now to offset the staff in the CAO's office. What it would do, and part of this is what got me thinking about this, is I was listening to the board with the new committee that you'd like to have, and then I started thinking about the potential of having 2 new board members coming into the board. That is always a big time. There's a big time requirement when we have new board members, and you guys have all been there. So I'm trying to figure out how do we get capacity for what we're doing right now. We are not responding to some of the COVID-19 stuff that we should be doing for OES. We don't do the planning. We don't do the exercises that we would normally do. This would allow us, kind of like your safety analyst, to have a dedicated OES person that would be funded. So that's one of the requests. The next one I started thinking about again as I was sitting here looking at Sarah. We talked about the committee, and then also new board members coming in was for Sarah's office. And so you may remember she had a legal assistant your board had approved. Unfortunately, the individual ended up leaving for personal reasons, and then she offered up that position to eliminate when we went through our budget exercise last year. That is also on here, and we have these in order of how we're recommending to the board. We have listed also to add back funds for the district attorney for her DA investigator, and I know that the district attorney is here if you had questions for her. The fire needs while we got a lot of individual breathing apparatus, what we do need is a breathing support vehicle. That allows them to fill those different individual apparatus so that they have oxygen when they're going into the different incidents that they respond to. And then the other thing I became aware of the last few days is we had stripped their training budget down to where even if they had volunteers, we wouldn't have been able to do the training that they need. We really do need to add that training back in. So the next one is facilities building. We've been talking about this as a potential, looking at ways that we might be able to pay for that. You could use a part of the fund balance. Debbie has explained that for internal borrowing, we can do 5 years for internal borrowing. There's lots of creative ways to get here because we can use fund balance from future years to continue to pay off that amount, and we are working with those owners right now to pursue that. But this is one of those options that we have discussed with your board in the past about that building. And then on the next page, we have a list of things, and we just bolded them. This is some areas of our concern and that we would like to bring to your attention. And most of these, not all of them, have to do with deferred maintenance and capital projects such as roofing. So the first one you see on there, and these are not in specific order, but replace the Washington Street Court roof. It needs to be replaced, and so Ed's given us a estimate there of $150,000. Quincy really needs that. She had a environmental health specialist that's frozen. She really needs that position. It would take them some time. There's specific certification required. She is asking that your board would consider to unfreeze that position, and that would be a mid-year that we would hope to be able to fill that. Part-time salaries for facilities, they're always needing just some backup when they have injuries or vacations or sick or just special projects. They will pull those individuals in. It also is a good training for when we do have vacancies. Those have been working where you really can get a gauge for, are they timely? Do they have a good work ethic? And what is their skill set? So it's always good for that. And then the senior center, we need to work on the ADA parking out there, so that's another issue. We have also our the 2 elevators in this building and in the A&F building. You guys are aware that these have been kind of causing us some issues for some time. This would repair them. The next item talks about additional elevator options. And some of that really would be, Eric talked about, if they get in there and the pump needs to be replaced, that would be, say, another $80,000. There's some other components built in. Then we have the Columbia Pool. When we do the CIP and the update, you'll get to hear more about all of this kind of stuff. We have an agreement with the Columbia School District that they give us use of that pool and our responsibilities to maintain it. A few years ago, and Eric's not here, but Mo could probably tell us, we put a few $100,000 into maintenance of the Columbia pool, but we need to do a whole replaster. There's a retaining wall that needs to be replaced, and then the restrooms are not ADA accessible. So there's some significant work that needs to take place out there. And then Stryker Court HVAC. And again, these are just a few of the items. So if your board were to do libraries, the first page, it shows the 710, and then the bolded items, I'm going to look at Eric, that adds up to the $1,270,000 that you have left to spend. And again, obviously you could do some or none of these items, but that would get you up to that full amount. You still have $1 million in contingencies, which is $250,000 more than what is required by your budget policies as well, just to keep in mind.
Okay, so everything that you've given us, if we add all of that up, we can pay for it all.
Except for the 271, the 500, and the 60 up there. So the bolded, and then the first page plus libraries you could add in.
Okay.
Libraries at what level?
At the 1920 level, the extra $230,000 would bring us to the 1920
And so
level.
if we went with the new plan, then we would have that $230,000 to put
To one of these.
towards a couple of these that are not bolded.
I'm sorry, my brain went dead there for a second. Which library option does this include?
This, if you did the all of these plus the 1920 status quo, so what we had before COVID,
Okay.
you could fund the old library system where everything was open.
So I'm missing the punchline here.
Well, we're asking your board. I don't know what you want to do. Do you?
Okay,
This is
I wanna-
where you want to bring it together.
If we can do these things, I want to do them. But I got to tell you something. I know that the personnel add backs in all of those departments, Ann's, Quincy's, Sarah's, all of those. For me, those are high priorities because I don't think the public really understands completely how our departments interoperate and support each other. And if we're short in one department, and I'll use county council as a good example, but it's true in all the other ones, it impacts our ability to do the other departments to do their job. Our departments support each other, and it's just, and if I'm going to fight for your person again, don't give it back to me in the next budget drill, okay? Thank you. But I know Quincy's hurting over there. I know Sarah's hurting. I know Ann's hurting. Those are my number one priorities. And then the rest of this, what we can pay for, I'm good with. And, well, let me say it again. Rec and at least the non-1920 option in libraries. We have to at least do that. But if we can do the 1920, I want to do that too. So
If I understood you correctly, if we do the 1920, then we definitely do not do the three that are not bolded on the bottom there.
Correct.
If we go to the new plan, then we can consider one of those three options additionally on the bottom.
Yes, you also have a little bit extra in your contingencies if you wanted to pull that down to the $750,000. And I do want to let you know that I've been informed by our Public Works Director that if you have an extra $250,000, they need a pothole paving machine as well. So that's also something that she just sent me.
I think Tuolumne County needs about 10 pothole paving machines.
I'm fine with the personnel issues, the ones that we, on the page, was it the slide back? Can we look at that one more time? And then, yeah, I'm fine with that. And boy, when that elevator breaks, we're all in trouble.
Yeah.
For sure. So the breathing, just real quick, the breathing support vehicle, We will, I know that the fire has submitted a grant. We just don't know when we exactly will hear back on it. We're also, the sheriff had a good idea because our boat patrol staff use it. Maybe we can kind of work together with some different grant funds so that there's not 100% impact to the general fund. So there could be some savings, but right now we know that's the approximate cost, and it is a huge need that they need for safety, obviously for entering into different incidents that they have to go to.
Any chance of some Parks and Recreation funds to fix that Columbia pool out there? No
So
grants
we
on the
actually,
surface?
our newest allocation is actually 400,000, and I can't remember the name of the prop funds that we get. However, Eric Aiken had hoped to put that pretty much the full 400,000 into Standard Park. There are a lot of, up that field, for example, he wants to do a lot of work on the field. So at this point, I would say no. Doesn't mean we're not looking and that he's not always looking to see if there's some additional funds we can pull down.
Obviously, I think that's an important one to do. I can't, in good conscience, put it ahead of any of the things that you've identified as higher priority. But if we can find money to do that, I'd certainly, obviously, like to do that. But and the other one, and it's relatively cheap, that Stryker Court high vac. You know, we're in there in the hottest months of the year, and we just had a near miss with a much longer visitation period in that center that we talked about already this morning. So all of those are important, but I think your priorities are what I would go with.
Couple questions. A few months back, weren't we talking about maybe consolidating part of Parks and Recs in with the library to have a cost savings? And if so, where was that idea gone?
Right, so we talked about during the recommended for a full year was about $353,000. For this year, right now, that's why there's a cost to take library back to what it was of the $230,000. And it's a part year. Remember, that's only from October forward.
Okay. Again, I just want to clarify, if you go to slide 27, I think it was. So all these positions would be funded, and then if you go to the next slide, everything in bold would be funded if we went with the recommendation for no tween heart. That model for the libraries, correct?
You could go back to status quo and have all of these items for what you have left in fund balance to spend. So it'd go back to, you just have to decide, do you want to spend the $230,000, but you would have enough in addition to those items that we've lined out, you would have enough to do both.
So we could risk, so if you go to slide 27, we could do all of those recommended staff-related actions, and then all of the bolded recommended actions on slide 28, in addition to $230,000 to maintain the libraries at their level, their pre-COVID-19 level, and then we would have a little bit extra, right?
You wouldn't have anything extra. It would pretty much uses all of it.
Okay,
But
and
you
then
still
there'd
have
be
an extra.
$250 in contingency.
You have an extra $250 in contingencies. Right now you
Over
have $1
what
million.
the policy is, okay.
Yeah.
So all of those things plus potentially $250 if we don't want to keep it in contingencies.
So what this means, Supervisor Kirk, is you would not have reorganized your library and your rec together. They would be separate. For some of you, I have explained to you, it also means we had been working on actually moving rec and UC Cooperative Extension out of that building, moving public defender into the building where we would no longer have rent in future years. That we would have to change, but I mean, it's relatively minor. We can make that change. We were just moving along with the reorganization and getting recreation out of there. If we don't, there's just not enough room at the library to add in those additional staff. That's the only difference.
Yeah, I can't. And then one last question, because I don't want to assume anything, because I think Supervisor Rutherford said this in prior meetings. But you know, whenever I look at the bookmobile, I don't think we need it. But I want to clarify: is that the only access that Columbia has, Carl, in your district?
It's the only access in my district.
In your district as well?
Yeah.
Yeah, they're a 15-minute drive Columbia is a 15-minute drive from the Sonora branch, and Jamestown is as well. I mean, I like the bookmobile, but I don't know. It seems to me, I remember when we've talked about it in previous years, the utilization rate on that thing is relatively low. Yes, no?
No, I think it's still pretty high. It just depends on the year. And I don't have the stats. We can always get those for you. But I think that you still have thousands of items that are checked out in a given year.
It is a valuable resource because we have a lot of people whose only means of transportation is walking. So I know it stops at the post office in Columbia, as an example, and it's a very good location for it. There's a lot of people that are within easy walking distance of that location. As an example, there's others. No, I don't have a library branch in my district, if that's what you're talking about.
I just want to confirm.
Let me add to the Lake Don Pedro area. It's 45 minutes or more down there, and we don't give them a great deal of services, but it does stop at the high school, and the high school does use it a lot for educational purposes too. So
that's why I was asking to get just a reminder.
Yeah, and I can add to that it also goes to many of our elementary schools and also to elder care facilities, people who are unable to leave and go to the library. The library is brought to them with the bookmobile. So
it's a valuable resource, don't get me wrong.
Okay.
It's probably not cost effective, but a lot of things we do aren't.
No, and
it's not.
And that's why I wanted to ask, because I didn't want to assume.
We're in the service providing business.
Right. We don't make widgets.
And so I kind of, with what Supervisor Campbell said earlier, I mean, I think you guys all know my stance on libraries. I'm a Google guy, I'm a computer guy, but certain issues I'm firm on, certain other issues I really try and hear what my constituents are saying. I try to do that all the time, but I also have my opinions. But the outcry I get from the Twin Heart area is just they want their library. And so if there's a way that we can keep it, I do know that there's things in the works. I wish it would have been done sooner, but I do believe in the next year or so there will be some sort of there will be something new moving forward to help the Twin Heart system. But if we can keep it going for this fiscal year, that's what my constituents want. And
Can I ask
if
a
we can make that
question?
happen.
If the
For that
Columbia pool, let's say it couldn't be open because of the condition.
It could
of
not
it.
be.
Pardon?
It cannot be open.
They cannot be open, thank you. And so what pools would be operating in the county?
If we continued renting Sonora, which would probably be our only option to keep a third pool, otherwise we would only have Twain Harte and Tuolumne. And Eric was saying, because he's working numbers over there, and I'm not meaning to throw any wrenches in there, but if you went with the recommended library option, you would have enough to do and reduce contingencies. We could do the Columbia pool. So if you took that 230 from not doing the library option, putting it back to 1920, and you reduce contingencies, you would have enough to do the Columbia pool.
So you're saying not go back to the 1920?
I'm just saying it's an option.
Okay.
Yeah, you could reduce contingencies, go with what staff is recommending for library services, and you would have enough to do your Columbia pool.
Yeah, and again, just to circle back also, because the rental on the Sonora pool was pretty high, if I remember.
It's $15,000. We didn't used to pay anything near that, but yeah, it's $15,000 a year now. And they don't give us the time slots that we really need for our parents is the other problem.
Right. We don't
They're
have the
doing water
flexibility.
polo and some of the others. So those time slots we need for parents, which are usually that between, say, 5 and 8 time in the summer, they have typically made them not available to us because they're doing some other type of sports activities.
And how many months out of the year is that pool open for the public?
Which one, Columbia?
Columbia.
Well, we only use it in the summer, so it would be, say, when school gets out, June, July, August.
So that's where I would also note is
We do have a responsibility, I just want to throw that because we
The
do have a
contract.
contract with them to maintain the pool too. So
In other words, we're going to have to fix it eventually.
we
Sooner
will
or
have to
later.
fix it fairly soon. We have an obligation to do so.
So on slide 27, the last item is facilities building purchase offset by internal borrowing. can we do something similar to that with the remaining, with the 250 in contingencies for the Columbia pool, to where we would maintain the 1920 with the library, pay upfront half of the $500,000, and then take a similar action with the facilities building for the remaining $250,000. Is that making sense?
It probably would just be easier not to use the internal borrowing for the purchase, whatever level the balancing act is.
Okay.
Usually what we've done in the past with internal borrowing is always to purchase property or buildings, not maintenance of a pool.
Okay.
So if you swapped it out,
Yeah.
You call it tomato, I call it tomato, we can make it work.
Okay, so, but I guess what I'm getting at is, do you typically need to have all of that money allocated in the first fiscal year when you're starting that project? Or can you do it over multiple fiscal years?
We need to have it in the year we're going to expend it. So if we think we will actually do it in order to get it working for next year, we would need it all for this fiscal year to get the work done. So you have to match it up with the year in which the services are provided.
Okay.
Again, so what we're talking about here is rather than put $300,000 towards facilities building purchase, offset by internal borrowing, use that $300,000 with the, was it 250 to do the pool in Columbia? I know. 300 plus 250 equals 550. Okay, so that's what we're talking about. And then Debbie, we could still purchase that building by doing something different with internal borrowing? Is that what you said?
What we would do is use internal borrowing with your internal service funds, probably post-retirement, to buy the building. But then remember, the next 5 years, you're going to still have payments on that building. Even this year, if we buy it sometime in this year, one should put the payments in.
Sure. Yeah. I do think in future years, Supervisor Rotifer, we begin using that fund balance to chunk that internal borrowing off and pay it off, which might be all of next year. We don't know. But it's the rent for right now, I'm looking at Eric's $40,000 a year for that building, 30.
It's probably closer to 45, I think.
Right.
Okay.
So, yeah.
Well,
Yeah, and I wasn't necessarily proposing an either-or type situation. I was holding that up as an example of of a funding method that we could apply to the pool. Not that we would take the funds from the facilities building and apply it to the pool, if I wasn't clear.
So we could use our internal borrowing mechanism to still purchase the facilities building and yet use your fund balance to do Columbia Pool. And then look at future years for fund balance to pay off that internal loan.
okay.
That's an option for sure.
I didn't clearly understand the Columbia Pool situation initially, I guess. But we, if I understand it correctly now, we have an obligation to address that anyway.
We do.
So I think we need to figure out a way to do that rather than kick the can another year down the road.
Yeah. Fairly quickly, if there are no other questions, I do want to go to public comment. I'm looking to see if there are any other questions. Okay. This time, is there any public comment? There is no public comment on this item. Okay. Thank you. We'll bring this back.
Well, again, I'll tell you what I think. I think I would like to see the libraries at the 1920 level, if we can afford it. If not, at least the recommended option. I would like to see the Columbia Pool addressed, principally because we need to address it eventually anyway, and there's no sense not doing it. If we can still do the facilities building purchase somehow, then fine, let's figure out a way to do that. Otherwise, maybe not. And then I think all of the, can you flip over one more chart? Yeah, all the bolded items there. And if we end up with some pennies left over, like $60,000 worth of pennies, throw it at Stryker Court. But if not, not. Other than that, I think your recommendations, Tracy.
I'm just concerned, and I don't know if we're giving you enough direction. I heard Carl talk about the 2 library plans. I would love to go back to the 1920 plan.
I would too.
I dearly would. But my concern is that we are over, when I look at the list of pieces that are not bolded, I am concerned. Supervisor Gray, you said it. The elevator goes out in the A&F building, and we've got a problem.
I think, though, with those recommendations and getting to, we got another month to the 27th of September to approve. Is it the 27th to approve it? 22nd. Gives us some time to refine some of that a little bit more. And I'm comfortable with the recommendations and going back to the 1920 libraries, even though that library that I dislike is in Supervisor Kirk's district. I'll go ahead and work for it. Even though he doesn't like libraries, I will vote to keep that library in place. So,
Just for clarification, because I'm not sure I got the differentiation, but the bolded elevator line of 260,000. What's the difference between that and then the additional elevator options again?
Yeah, so I'll kind of break these out a little bit for you. So the first part is what they're calling full modernization. Essentially, they're going to replace the wiring, the drive, new signage, new ramps for ADA requirements, the lights, because there are some minimum things we have to do for safety and
Sure.
ADA requirements that have to do done. There are some additional options that we can elect, such as expediting the schedule of the process, which takes it from 4 weeks of downtime to 2.5 weeks of downtime. Obviously, logistically, we're going to have to work with that. Installing a new in-the-ground jack if it is leaking. We won't know until we actually get in there to start replacing and working on the car. So new cab interior and handrails, new lights with LEDs. Those are some of the options that are in there that are in that 271 number.
But the bolded line, the 260,000, fully modernizes those elevators.
And will make them more reliable. Yes,
Okay.
correct.
Then I'm still where I was before.
Yeah. And I think we're pretty close to the same wavelength here. I'd say the only way, the only thing I'd clarify a little bit with where I'm at is that I would tend to prioritize the 1920 restoration of the libraries above the pool, just because that is the more immediate issue. I don't know when, but someday kids will start going back to school. I hope very much, and those services are going to need to be utilized basically immediately. Whereas the pool, will be long through summer before we're able to address that. And so we'll have a bit more time there to come up with a solution for funding that, whether it is with the remaining contingency or coming up with some other kind of plan. I guess that's where I'm at.
I think you're just making it more complicated. If we stick to what the CEO is recommending, we will get to where you need to be.
Yeah, because I would disagree with
Okay.
that.
Just might be.
So-
All right, well, I will shut up then.
And I just have one or two questions and a final comment, but I'm going through just adding this up. It looks like when it's all said and done, we're adding about, with grant-funded positions and whatnot, about 5 positions. Is that correct?
No.
Or more? Community development
The
manager,
planning manager.
human resources.
Oh, wait, there would be 5 because the environmental health specialist.
Right, so about 5, and then we're approving some salary stuff for part-time salary facilities and one other one. And so again, we're gonna have a month to work the plan, but I just want to say this because I try to bring some reality to the bubble of government.
We don't have a month.
We're talking about a TOT tax increase moving forward. And if little things, you just got to understand, this is public perception. If we're bringing back positions, but we're not funding something like a library, I want us to understand the way the public perceives these little things that happen internally.
But that's not what we're doing.
I'm just trying to bring some reality to, if we move forward, it's important that we try and get these libraries funded, because if we don't, that's going to be the perception. Positions created, services cut. So I just want to say that moving forward.
Tracy, do you have what you need?
I do. Yes, we'll put this together. So to make sure that really libraries is the one. What I'm hearing is 1920 service level, right?
If possible.
If possible.
I mean, it's possible if we do what we said on there. What I'm hearing is we would use fund balance, also reducing contingencies, part of that fund balance, to do the Columbia pool. But I will work with Debbie, Eric will work with Debbie, because he does properties, to work on the purchase of that facilities building as directed previously, to make that purchase, and we would use internal borrowing to make that happen. If we can make it happen, we're still in the process of working that. That's what I'm hearing, in addition to the other bolded items. We will continue working all of those other pieces as we get closer to the 22nd. But that's what I'm hearing from you, is that what you want to do?
Well, hopefully you're done chasing the fund balance bogey.
Yeah, I don't chase it at the end. That's Debbie chasing it. She says she's finished. So the only other thing you haven't heard from, and I don't know if they want to come up, would be Rebecca and or Kim. I'm trying to think, or if there's any other non-general fund department heads who want to address you. What I've done in the past, and we've worked with them, is if they need new positions, we would talk with you about it. Obviously, only you can approve that. But if as long as they can balance it, I also work with them not completely utilizing all of their fund balance, so they carry some forward. We usually just put that together and we bring it to you in the adopted budget, knowing that they have to balance amongst their own revenues anyways. But I believe they're here in the event that you have questions, or they wanted to address you or clarify any direction. And I don't see anyone jumping up.
How you do?
Yeah. Oh, there's
It would seem as long as it's going to balance, it really.
That's usually what we do with
Doesn't
human
make-
services and roads. We just make sure they balance. But
Welcome back, Rebecca.
I'm just here to answer questions if you have any questions regarding our proposals.
No, just balance your budget. That's very
Yes,
simple.
we're on it.
Okay.
Shouldn't have any choice.
Yes, you're right.
Thank you.
Thanks, Rebecca.
All right.
I think we're good.
Okay.
thank you.
At this time, I'm looking, we have one more item that the ladies are ready to.
Let's get it done.
Present.
Do it.
Very good. So if the clerk would read item
Whatever.
14.
You want this one, you guys?
Item number 14, consideration of approving a contract between Visionary Home Builders, Inc. and the County of Tuolumne to assign the county's $500,000 no place like home allocation for the construction of an affordable rental project with a permanent supportive housing component.
Ladies, good afternoon. It's been a marathon day for you, I know. I'm Sheila Shanahan, Community and Housing Program Manager for the county. We're here today talking about the No Place Like Home grant funds. The county applied for a No Place Like Home technical assistance grant way back in 2017 to create a county plan to combat homelessness and begin working on what needed to be done to create more permanent supportive housing in our county. So community development and behavioral health work together on the county plan to combat homelessness, along with community partners and local experts. And that plan was approved by your board in 2019. And not surprising, the number one priority was the need for more affordable housing. The board approved a $500,000 No Place Like Home non-competitive grant And that was an application to the State Department of Housing and Community Development to build or provide permanent supportive housing. So staff and the Board of Supervisors Housing Policy Committee, which has been providing oversight, we've been working on how to use the funds for an affordable housing project. And recognizing the need for more affordable housing in general, not just for No Place Like Home, the idea was to leverage the $500,000 grant towards a larger project, where a small portion of the units are funded with No Place Like Home, and the rest would be affordable housing for families, veterans, and seniors. So finding a site has been difficult, and you see the slide there. The site, it needs to be vacant, obviously, for sale, near services, utilities, other infrastructure. And in order for these projects to apply for state affordable housing financing, the criteria for services and amenities is very specific. And all of these programs are extremely competitive. And if a site doesn't tick all of the boxes, they won't be able to secure funding. So you can see on the list just how specific and difficult it is. You know, being less than a mile from a full-service grocery, a hospital, a pharmacy, being a half a mile to a school. So in order to find a vacant site that's for sale and meets all of the criteria, especially in a rural area like ours, is extremely challenging. So the hospital, Adventist Health Sonora, as a community partner, they were open to talking with staff about the possibility of selling vacant land that they own to an affordable housing developer so that the county could use the grant to provide affordable housing in our community. And I want to acknowledge Supervisor Brennan for helping to set up a dialogue between Michelle Fuentes, the president at Adventist Health Sonora, and county staff. Thank you. So they have a site, and you can see it up there. It's central. It meets all of the criteria. It's on Greenlee and Kabasu. It's coastal amenities. It's in an opportunity zone. It meets all of their criteria and will be an ideal site for this type of project. So you have the second slide there showing the resources. Okay. So having identified the site, staff issued a request for proposal to affordable housing developers to utilize the No Place Like Home grant. And we received 3 applications, and the proposal from Visionary Home Builders, who is partnering with the Stanislaus Housing Authority, ranked the highest by the review committee. Visionary Home Builders is a nonprofit affordable housing developer in Stockton with an excellent reputation. And the Stanislaus Housing Authority is the housing authority for our county, and we have a close working relationship with them. So the contract that before you today would formalize the relationship between the county and Visionary. And the county would be agreeing to direct the No Place Like Home state grant funds to the project, along with some other state pre-development funding. The county applied for some state grants that are in part earmarked for pre-development activities like rezoning and pre-development studies to make it easier to develop affordable rental housing. I wanted to stress that no county general funds would be used for this project. These are state grant funds that are designated for this purpose. The county wouldn't be involved in owning or developing the project or purchasing the land. There would be no liability to the county. If the contract is approved, Visionary and the Housing Authority would begin pre-development, and with today's action, you wouldn't be approving the project. It would go through the normal development process. And we would like to give you some more specifics about the project. And Quincy, did you want to?
Quincy Yaley, Community Development Department Director. We are joined today in our session here by Carol Ornelas, who is the CEO of Visionary Home Builders, and Michelle Fuentes, who is the President of Adventist Health. They are here digitally. Hi, guys. We see you. Hopefully they can hear us. They're in charge of their own microphones, but they are here to help answer any questions you might have about the project, the site. And I know that Carol also has some example projects that I can put up on the screen should you have any questions. So at this point, we just wanted to check in with our chair. I know it's been a long day, and see if you would like to have either of these two partners speak with us.
Absolutely.
So, Michelle, why don't you? I think you've been on the Zoom call longest, other than myself. So we'll let you go first. We're going to try it this way. Okay, we'll see if it works.
Well, I appreciate that, Quincy. I tried to keep the video off, and I got some other work done. But I have sat on this phone call all day listening to your meeting, and I've done that because I think this is a really important project for our community. I had never heard of Visionary Home Builders up until this project, but I have to tell you, I'm really impressed.
We just lost signal.
Yeah. Michelle, you probably
Hold on,
have
Michelle,
us
1
muted.
second. Hold on, Michelle. There we go. Okay, Michelle, can you hear me?
Yes.
Okay, we can hear you now.
Sorry.
Sorry, Michelle. Okay.
Does that mean that you didn't hear anything I just said?
Well, we heard you say that we're really great partners and you love working with me. So I'm pretty sure that's what you said. But if there's anything else you wanted to add besides how great I am, go ahead.
Quincy, you are fantastic. That's all I can say about you in public. But I will say that I had never heard of Visionary Home Builders up until our meeting. And I have to tell you that from a woman who has a lot of experience in architecture, planning, design, building things from an old life, I'm extremely impressed with their portfolio. But what touched me the most is their desire to build affordable housing that families can be proud of. And that really struck a chord with me. And so couldn't be more excited to partner up with them as we bring a really needed component to this community. Additionally, I'll just say that the team in the county office has been phenomenal to work with. And I give them tons of kudos for having just the audacious planning. We were actually meeting about something fundamentally different when I think a light bulb went off. They knew this property was available, and this entire thing was created. I really think it's a God thing that it's working out just the way it has today. So I'm here to show my support and make sure you as Board of Supervisors understand how excited Adventist Health is to bring this needed resource to Tuolumne County. Thank you for your time.
Thank you so much, Michelle. Carol, I think you can see my screen, so feel free to jump in, and I also have your slides that you provided to us.
Great. Well, good afternoon, everyone. I'm so excited to be here. The partnerships that we're forming here and the collaboration is just totally awesome. Just as we heard, for me, Adventist Health was very new, and then all of a sudden, I find out that they're now here at Dameron Hospital working in Lahudai, and they want to meet with me on other things in our community. So, it's always about connecting the dots and who can come together and collaborate. So definitely we're looking forward to working with Adventist Health, with Sheila and her team and Quincy to develop this community. Visionary Home Builders has been developing affordable housing for over 35 years. We have concentrated in the Central Valley and in the foothills, developing and tackling where no one else has really developed a lot of affordable housing, yet some of the greatest needs are in our rural areas and in the Central Valley. To date, we have developed 1,500 doors that consists of 28 communities. Recently, we were funded 2 ASAC communities in Stockton. One will be our veterans housing. It will serve our veterans and families that are taking care of our disabled veterans. And then we were recognized by the state, and we've got the first disposition of land by the state to develop 92 units that we are going to bridge seniors and families because of studies that have been done by Dignity Health that shows that the seniors are very lonely and our families don't have childcare, and so hopefully we can reunite both communities together. But when we read about this proposal, right away we knew that we wanted to take a look at this community and see how we could help out. We don't go into a community and say, we're here, we're going to build this. We know that there's a lot of work yet to be done, meeting with the community leaders to hear what they see as their community housing project that we have slated. We know we can get approximately 80 units on the property. We still need to do some further investigation just for environmental clearance. We know that we're going to be adopting some and preserving some of the land that is unbuildable and incorporated into our community design, but which will be really cool and awesome. One thing that Visionary really tries to do is to create communities, and communities that people will be proud to live in, proud to know that when you drive by, you're not going to say, oh, well, that's the low-income housing community. We want our community to be one that the whole community is proud that they have and is serving some of the very lowest income people. What is very great about our design is that we're going to incorporate housing for homeless, but then surrounding them by love from other families in our community. We know that we can mesh it all together. Visionary has a second chance program that we will immediately, once we get further into design, because by the time all the funds are in place, we know that it'll take anywhere between 12 to 18 months to build it, but in that during that time, we will be working with HSA and other community nonprofits to identify our homeless population and start to work with them to transition them into permanent housing. We're excited. We can hardly wait to get going and very humbled by being chosen to come into your community and work with all of you to develop this housing community for those that most needed in your community and those that are working, because definitely what COVID has shown to everybody how important housing is, and that we need housing across the board for everyone from homelessness to those that are working. There's just a lack of housing throughout the state, and definitely in Sonora there is still a great necessity for housing there as well. So I'm here to answer any questions that anyone may have regarding the proposed community.
Thank you so much, Carol. At this time, all of us are here. We also have Michael Wilson and Rebecca Espino from HSA and Behavioral Health, who are going to be integral partners in this project as we move forward. We are just in the early planning stages. There's a lot of additional review and outreach that needs to occur. But I also do want to extend my thank yous to Visionary Home Builders, Adventist Health, and our county staff who have been working really hard on this. So we're here to answer any questions that you may have. Thank you.
I don't have a question, just a comment. I've been on the housing committee for a long time, and I know how hard it's been to find something that actually works. And I've been here like I said, a long time, and that property's been sitting up there, and I had no idea that Adventist Health would be interested in coming forward. And what a perfect spot. It's right next to everything. And I don't know where was it 74 units?
Yeah, we're 80 plus or minus.
Okay, how far that goes in, towards us meeting our goals of having workforce housing and housing for everyone that needs it. But I'm pretty excited, and I know it doesn't come easy, and all that collaboration is great. And I know Sheila probably didn't do anything on this, but I'll give her a little bit of credit. Thank you a lot.
Well, it's been a long time since I've seen you, Sheila. I know you've been busy. Thank you for bringing this forward. I just can't say this enough and often enough and loud enough, believe it or not. But the partnerships that we enjoy in this county in trying to do our work, and Adventist Health, Sonora, and now Visionary, I mean, honestly, I can't say thank you enough to the partners that have come into this. We can't do these kinds of things, and good Lord knows we need to do these kinds of things, and we can't do them without those partners. So those of you that are on the horn, thank you very much for, and I know it's not just the two of you. I know it's your organizations and your organizations. So please pass on our sincere thanks for being partners in this very important project, and I'm looking forward to it.
Thank you.
Yeah, I agree with everything that was said. I really have to salute Adventist Health for stepping up and being a part of this. And since we talked about this plan initially, I have had time to do a little bit of research and look at some of the projects that Visionary Home Builders have been involved in. And wow, I did not realize when we initially talked about this how lucky we were to have them involved in this. That some of their projects, they really look nice. I mean, the projects that they build are really good quality. They really bring an asset to the community that they build in. As others have said, that's an amazing location where there aren't too many places that are within walking distance of services in the community, but this is one. And to be able to put 80 units there, I think, is really going to add to the accessibility to services without having to walk. And then one of the things that we talked about before was if we can incorporate either a bus stop or some kind of consideration for public transit there, I think that would add even more to it. But yeah, it's a great location, wonderful partners involved in it, and the two folks sitting before me have done a great deal of work getting us here. So thank you very much, Sheila and Quincy.
Yeah, and I had an email from my constituent, but I figured if one's asking it, that probably means there's 50 wondering. Can you just quickly touch on the amount of units, and then are there going to be units for homeless people or to offset housing needs for those?
It'll be approximately 80 units.
Okay.
The total number hasn't been determined, and a portion, maybe somewhere 10 to 20%, again, to be determined, would be the permanent supportive housing units.
Okay.
And the rest would be for families, seniors, they would be affordable housing.
Okay, thank you for saying that again. So again, reiterating what they said, what I love about this is it's not the county owning it, it's the collaboration with everybody, all the stakeholders. Big thank you to the hospital. I have, my opinions have changed a little bit on this matter, and I think if it's going to work, this is the way it's going to work with all these collaborations, and so I'm glad to be a part of it. And actually, we're not really doing much other than you guys are doing all the hard work. So thank you, and look forward to seeing how this develops moving forward.
Yeah, and that kind of brings up another question. So with permanent supportive housing, we already have existing permanent supportive housing within Sonora and elsewhere in the county. Correct? Yeah, so this isn't something new that's being brought into the county. It's just an extension of some of the resources that we already have in an area that's particularly well suited to those resources.
Yes, and it's an opportunity for, the social services and behavioral health to have a nice place. They do a lot with their clients, and they are here if you have any questions. They're already providing those supportive services to their clients who have a hard time finding an affordable place to live.
Yeah, and the only reason I say that is that you will get the, not in my backyard kind of attitude sometimes, but the point I'm trying to hammer home is that these types of facilities operate next door to all kinds of folks, and they don't hear a word about it, and so it's something that's really needed in our community and is already here and functioning quite well, I think.
Yeah, Supervisor Campbell, this is what we would consider part of the ladder of housing. So it's really fitting a need in a range of housing types that our community needs, so that we can help move people from homelessness or a substandard housing situation into a better home, and then we can move them from there and up we go. And so this is just the beginning of the process. There will be additional times that we come before your board with information and or public hearings. There'll be additional environmental review that's done, as well as community outreach to receive input on the design of the project, the functioning of the project, and the services that are going to be offered there. So this is just putting our toe into the pond, so to speak. We'll be back before your board and in front of the community with more information as time goes on, and to listen to input and mold that into the project.
So thank you for that clarification, because that was really going to be my question, is to let the public know that there will be opportunity to have input into the process as you go through it. And that is important, that the neighborhood has a chance to address this. But I would invite everyone to go and look at Visionary Builders. Because again, when I looked at the, the level of homes that they were proposing, was just astounded. I think anyone should be proud to have this kind of development in their locale. And I think it's just going to be a tremendous asset. For as long as I have been on this board, we have talked about housing for our seniors and for those other vulnerable populations that are just living day to day, literally. And then workforce housing, and how, what a challenge it is. And so I'm going to say out loud that I am proud of the work that you ladies have put in, and really want to thank Michelle and Adventist Health. Literally, we were meeting on another topic, and Sheila came back and said, it was just like a bright light went on, and it was, what about? And literally all she had to do was ask. And sometimes I think we forget to do that with some of our partners. And immediately, Adventist Health was in the conversation and looking on, how to move this forward. Because again, they recognize the tremendous need that we have with regards to affordable workforce housing. So with that, I just want to thank all of the partners. I am excited, and at this time, I'd ask if there is any public comment on this item. Seeing none, I'm going to bring this back to the board, and since it is in my district, I am going to take the prerogative and move approval of the contract between Visionary Home Builders and the county.
And I will second that.
So, motion by Supervisor Brennan, second by Supervisor Campbell. All those in favor?
Aye.
Aye. Motion carries 5-0. Thank you very much, ladies.
Thanks, you guys.
This
Bye,
was-
everybody. Thank you.
Thank you so much. Everybody have a great
Thank you. And with that, we are going to dispense with reports today, and we are going to adjourn the meeting. And thank you, everyone, for your flexibility moving through the agenda today.